Good morning, everyone. Hello. I'm Sandy McKay, the Huffington Fellow in Child Health Policy and Associate Professor in Pediatrics at the University of Texas Health Science Center at Houston. And I am honored to welcome you to the Baker Institute and to our 4th annual symposium on firearm injury prevention and safety, preventing firearm injury through purpose and policy. We are honored to bring you this event with generous support of our gold sponsor from Memorial Hermann Hospital, our bronze sponsor of UT Health Houston, and our supporters of Harris Health and Texas Doctors for Social Responsibility. This event has the goal of understanding the various aspects of firearm injury, how it impacts communities, and what can be changed in order to influence change. We are all familiar with the numbers. Almost 47,000 people died from a gun-related injury in 2023. Suicides accounted for 6 in 10 deaths over this time period. Every year, 547 women are killed by their husband or male dating partner. Gun violence costs the U.S. economy over $500 billion annually. And since 2017, it has been the leading cause of death in children and teens. These numbers sound overwhelming. What can one person do to combat this? Well, over the last few days here at the Baker Institute, we've been teaching a firearm policy seminar to address this very question. We took a tour over the history of firearm policy. We learned about how the NRA was initially an organization prior to 1977 that was focused on hunting, wildlife conservation, and was in favor of incremental forms of gun control regulation. They even assisted in drafting the Gun Control Act of 1968. We learned about the social influencers of policy, including the 1989 Stockton schoolyard shooting, one of the first school mass shootings in California, which resulted in 5 children that were killed, 31 that were injured while playing on a schoolyard. This led to the first assault weapons ban by a state, and that was the policy foundation for the 1994 federal assault weapons ban. We also learned that while policy responses are often narrow in scope because they respond to a specific event. You guys see the theme there, right? Also, we learned that as time passes from that event, the political will to act will often decrease, and that cycle starts again. While mass shootings only account for less than 2% of all the firearm deaths, they are the ones that make the most headlines. We are all too familiar here in Texas with the headlines, especially those from Santa Fe and Uvalde. It changed the way we feel about our kids in school. There are reports that 44% of parents feel that their children are unsafe in school. Additionally, nearly 20% of children in our own Houston Independent School District have missed a day of school in the last year due to feeling unsafe. Understanding how we respond to these types of generational shifting events is critical as to how we look to impact change. We also discussed the changes to the funding streams in the last 135 days and the impacts to firearm funding, along with the dismantling of the Office of Gun Violence Prevention and the removal of the Surgeon General Advisory on Gun Violence as a public health crisis. Again, we asked ourselves, what can we do? We spent time discussing the Richmond model for policy change. We learned that you need 3 key components to shift policy. You need scientific knowledge, you need a strategic plan, and you need political will. Being armed with knowledge and a plan is imperative so that when the political will is there, you can respond that is based in evidence and that has purpose. We learned about how you can move levers of change, identify key stakeholders, and how to tell stories that can influence change makers. Collaborating with diverse and sometimes unique partners can add depth to your story and your mission. We learned about the power of collaboration. Shared voices, such as those that were originally started with the Million Mom March on May 14th, 2000, or the voices that were elevated through the original Facebook group started by Shannon Watts after Sandy Hook in 2012 can be powerful. Shannon Watts elevated her message through social media conversations to empower people across the country to take action, turning this movement into Moms Demand Action with over 11 million members. So, with the Million Mom March and Moms Demand Action, this is a testimony to the strength and resilience of mothers and their passion for protecting children. We learned that you need a plan and a solid foundation of evidence, along with a base of partners to collaborate with in order to begin the journey to impact change. That is probably why many of you are here today, to gather knowledge, to flesh out your plan, or to build out your base of people. I am excited to say that we are your people. I am excited for our future. Today, we will bring you a series of esteemed speakers to understand the various types of gun violence. We will examine suicide prevention, community violence, intimate partner violence, the role of youth in engaging in firearm injury prevention, and we will welcome our legislators to discuss firearm policy at the state capitol. We hope to share with you all their knowledge, passion, and expertise. We also hope that throughout today you will continue to engage with each other on your work and interests so that we can help to create those valuable connections and continue to promote your work. A little bit of housekeeping before we start our day. Out of respect for our speakers, please keep your phones on silent. We will have opportunities to write in your questions on the cards that are provided for you at your table. We will have team members come by periodically throughout the day to retrieve them. There are restrooms located on either side of the stage here, and there's beverage service in the foyer. If you have any immediate needs, please feel free to see myself or Katerina Reyes, who is our Child Health Policy Research Manager. Thank you again for joining us today, and I am excited to bring you a full agenda of engaging speakers. I would love to turn this day over to my co-host, my colleague and friend, Dr. Eric Fliegler. Dr. Fliegler is a non-resident fellow here at the Baker Institute and a pediatric emergency medicine physician and health services researcher at Massachusetts General Hospital and associate professor of pediatrics and emergency medicine at Harvard Medical School. Thank you so much.
Good morning, everyone. Thank you all for coming here. You've come here because you care about gun violence and you care about what's going on in this country. It is important to know, as we go through this day, this is a hard topic. As Sandy has already said, we're going to talk about suicide. We're going to talk about homicide. We're going to talk about disparities. And we're going to talk about the challenges of addressing this situation that's going on in our country in, quite frankly, a unique and totally different way than anywhere else in the world. And so if these subjects are hard, if they hit home, you're not alone. And I just want to recognize that up front for all of us. Sandy alluded that there's, in 2023, over 47,000 firearm fatalities. That is, of course, just the tip of the iceberg. There are over 250,000 people who will end up in the emergency departments and hospitalized with firearm injuries. There are families, communities. There have been recent surveys that have asked participants across the United States whether they or family and friends have been affected by gun violence. 1 in 3 said yes. 1 in 3 have been affected in our country by gun violence. We have a lot going on about our deficit right now. We spend tens of billions of dollars per year on medical care for those who are injured by firearm violence. I don't know how many of you read The Onion. Show of hands, who knows The Onion? Great. It's kind of a source of solace for me, although it touches close to home quite often. Every time there is a major firearm mass shooting, they publish the same article with the same headline. There is nothing to do, says the people of the country, for whom it is the only place in the world that this occurs. There is clearly something to do. I take great pride that my 3 children have all developed an interest in this subject matter. Not surprising, I've been doing research in firearm violence for 13 years, and so they've heard me speak about it, they've been immersed in it. And my youngest child, Lex, recently decided that he was gonna do the Students Demand Action, help start a group, part of Moms Demand Action at the student level. And he was asked to speak this weekend in Boston Commons about the subject, and we were discussing what he was gonna talk about. And he said, "Dad, can you remind me about what happened when you were asked to speak to the Australian Pediatric Society?" I was asked to speak at their meeting. They are the meeting that takes place it's for the oceanic countries, Australia, New Zealand, other countries, Papua New Guinea. But they're very smart, unlike people in the United States. They make a holiday out of it, so they pick destinations around the world. And that year they had chosen Boston. And they contacted me to speak about firearms. And I said to them, "Why? Why do you want me to speak?" And they're like, "Oh, we don't understand what's going on with you guys at all." And they're important to reflect on because the truth is, wherever there are guns, the potential for tragedy always exists. We understand this. Mass shootings exist, and they have happened in Australia and in New Zealand. And you are probably all familiar with what their response was. Immediately, within days, their government has said, "We cannot allow our citizens to live like this. This is unacceptable." And they have taken various approaches. Now, one of the approaches that most people think they do is that they've gone ahead and banned guns and take them all away. That's actually not correct. What they have done is they've taken a look and said, what types of guns are there being used in these things? What types of guns do we as a society want? And what types of guns do we want them to not have available? These are all countries with fantastic hunting traditions. That is a part of their society, and quite frankly, in many of these areas with the animals that are out there, it's an important thing for their safety too. But they made decisions about the types of guns that they would take out of circulation, and their society agreed to this. And we saw reductions in the types of fatalities they had. We live in a society where guns are an intricate part of our culture. This isn't going away, we all know this, and that's fine. As a matter of fact, Sandy was very generous and took a couple of us to go shooting yesterday. It's an important experience, and I understand the fun and enjoyment that people get out of this, and I understand why it is a long part of our tradition. But what is not acceptable is 48,000 people dying, 250,000 people being injured. I'm a pediatric emergency physician. When we think about the #1 killer of children in the United States, anybody want to guess what it is? Think about where we are. We all know the answer. This is firearms. That is astounding. More children ages 1 to 19 die by guns than by motor vehicle crashes. If you took every single child in the United States who died from cancer, heart disease, congenital problems, infectious disease, all the medical conditions that cause fatalities in children, and you added them all up, you'd have to nearly double it to get to the number of pediatric firearm fatalities every year. It's not acceptable. It's why we're here today to work together, and there is something we can do. So thank you for dedicating your day to being here. I'm honored to be here with you. Sandy, thank you for making this happen. Katerina, thank you for making this happen. It's my pleasure to introduce somebody who's become a very dear friend, Jennifer Netchie-Deneen. She is currently an associate professor in residence in the School of Public Health and a health policy fellow at the Institute of Collaboration on Health Intervention and Policy. It's a mouthful, they just go by INCHIP, at the University of Connecticut. She is also the associate director of UConn's Center for Advancing Research, Methods, and Scholarship, ARMS, and Gun Violence Prevention. Dr. Deneen is a survey methodologist whose research focuses on stakeholder attitudes as mechanisms for intervention uptake and for policy change. She has also expertise in understanding how stakeholders interact with political institutions in the policy process, and it's why one of the most exciting reasons for me to talk to her, because I do a lot of numbers, she helps me figure out what we can do about it. She is a co-editor of the Preventing Gun Violence in America, What Works and What is Possible for the Annals of Political and Social Sciences, and a forthcoming Vital City issue exploring the disproportionate impact of firearms in women in America. Dr. Deneen works on interdisciplinary research teams and holds in the areas of gun injury prevention and behavioral health politics and practice, and is a PhD in political science from the University of Connecticut. It is my great pleasure to introduce our keynote speaker. Thank you.
Good morning, y'all. Thank you, Sandy and Eric, for having me, and for that, Eric, for that lovely introduction. My name is Jennifer Deneen, and I am here to talk about partnerships to reduce firearm injury in America. Oh, it did work. Excellent. So before I jump in, I want to make a couple of acknowledgments. Obviously, thank you so much to the Baker Institute for Public Policy for having me, including the 2-day workshop that Sandy talked about. I've enjoyed my time in Houston and learning from you all, and I look forward to learning more today. I'm glad I get to speak first. I'm super competent. Why is this not? Oh, is there a clicker? Oh. Thank you. Thank you, Katerina. I want to acknowledge, if I'm going to talk about partnerships, I'm not going to mention all of these groups by name, but everything I'm going to share today, whether it's a work or an idea, has been informed and is a product of partnerships that I have personally, support of funders, support of my great co-authors and research team, and support of colleagues that I've made, including Eric and Sandy, in different workshops and conversations I've been fortunate to be a part of. And I would be remiss without acknowledging Hidea Pendleton, the young woman who was killed on January 29th, 2013, while we're all wearing orange, something that her family, friends, and those mourning her started. So I think I see so many orange shirts, but I did get a couple of questions about where orange came from, and so I want to remember why we're here. Okay, here's my agenda, sort of our roadmap. I'm going to talk a bit about my road to firearm injury prevention research. It's not the typical path. I'm going to talk about some partners in prevention, and then I'm going to get into some specific partnerships that I both work on and that my team is pursuing. Clinical care partners, firearm owners, and then the retail partnerships in the insurance industry. So my road to firearm injury prevention. I'm going to try to give you the TLDR, but my children who are like college age will tell you that my TLDR is kind of long, so apologies. You might be asking yourself, why is a survey methodologist giving a keynote on firearm injury prevention today? Super fair question. I came to this work through my political science training, and my belief that government decisions should really reflect the individuals who those decisions applied to and consider their lived experience and be informed, this is I think even more important, by those who we ask to implement a policy or practice, right? So many times, whether it's researchers or policymakers, we come up with an idea, it's going to fix a problem, and we don't actually ask the people who we're counting on to use that idea, whether or not it's going to work. And so I switched over time from being interested in elections. I used to predict elections. I'm sure you all understand why I don't do that anymore. And started thinking about, how do I use my training to give citizen voice a place and a process that it doesn't have a natural way to join, right? We can individually reach out to legislators or policymakers, and we should do all of those things. We can talk to people in interviews, but how do we find big voice, right? Because oftentimes, especially with contentious policy issues, or really what people in my field call wicked problems, those things that are super complicated and have lots of reasons, the people with the loudest voices don't necessarily represent everybody. So how do we give voice to everybody? So at the time, I'm gonna jump ahead a little because I'm old. This started happening in like the early 2000s. And around 2012, most of my work was in education policy. So now you're like, survey methodologist who's about to tell me about education policy. Again, fair, but I'll get there. As I said to Sandy yesterday, it takes me a while, but I will come back and make this all relevant. So I was working on a project that was really interested in what educators and education stakeholders thought about different ways that we screen children for mental health wellness. And schools have a variety of ways, right? So we were doing projects with school superintendents, building principals, teachers, and what we called student support staff. So school psychologists, guidance counselors, social workers, et cetera. And my job, I wasn't an education policy expert at the time, was to design the questionnaires and the interview guides that we would use to collect data from these people. And these guides focused, and the questionnaires focused on 4 areas. What did stakeholders know about the need for screening? Were they willing to consider other methods other than what they were doing? Did they think these other methods were actually useful? Would they make a difference to how schools ran, to outcomes, right? To keeping children well, to fewer behavioral issues? And even if all of those things were true, could you do it in their classroom or their school? Like, would it literally work logistically? Sometimes they agreed with everything, but there were reasons that they thought this wasn't going to work, right? Because we knew that more screening was better for children. We knew that catching behavioral health challenges when we are still internalized, so before a child is acting out, right, externalizing behaviors, helped the child. It helped the classroom, it helped everybody. But why weren't people doing more of this? So we asked. So now it's 2012, and I am steeped deep in this project, and the shooting at Sandy Hook Elementary School happens. I'm from the University of Connecticut. I was in Connecticut. And like many people in the country, similar to the experience that maybe many of you have had with Uvalde and Santa Fe, this changed me profoundly, not just as a person, but as a researcher. And there's a number of reasons. First of all, Connecticut is a small state. Now, I was trying to figure out how I explain to people in Houston how small Connecticut is. So I went to my new personal assistant, ChatGPT, and I asked them, ChatGPT, how do you explain to a room of people in Houston, I'm not kidding, this is literally what I said, how small Connecticut is compared to Texas? And ChatGPT told me, if Texas is the dinner table, Connecticut is the coffee cup. And then it helped me make this picture. I was so excited. And so I also talked to my colleague, one of the people in the acknowledgement slides, and my best work friend, my BWF, is from the Houston area, about an hour outside the city, grew up on a cattle farm. And she said, or you could just tell people that it takes as long to drive from one corner of Connecticut to the other as it does to drive across the city of Houston with traffic. So either way, Connecticut is a small state. And what that means is that actually, I'll go back for a minute. Oop. Maybe I'll go the right way. Oh, sorry. So what that means, you don't want me to drive your car either. What that means is that a few things. If you didn't know somebody at Sandy Hook Elementary School, you knew somebody who had someone at Sandy Hook Elementary School. Also, my husband is an elementary school principal. And so he had colleagues he worked regularly with the superintendent of the Newtown School District. I spent my days, my work life, interviewing teachers and superintendents and school psychologists about challenges they were having in school. My youngest child was still in elementary school, all of those things. But why I shifted my research agenda may not be the reasons you're thinking. Those all had a place in the conversation, but they weren't the conversation. Because what I saw, both from my research, from daily dinner table conversations with my husband, Jim, was time and time again the policy response to shootings in schools, and in this case in an elementary school that includes very special populations, right, young children, was well-meaning but off. And I saw and heard about people doing all sorts of things without asking anybody who had working knowledge of the building operations, of how you care for young children, and how you manage, developmental appropriateness. They weren't asking those people. So we had lots of good intentions. But the people who ordered bulletproof glass in a town, for the buildings in a town about 20 minutes from me, did not check with the facilities managers about the ability for the buildings to support the weight of that glass. There's a town that spent hundreds of thousands of dollars on glass they could not install because buildings in Connecticut, everything's old, right? Like, we've been around a long time up there, and our schools are old, and the bricks couldn't support the weight of that glass. I talked with administrators who were really struggling because their public safety chiefs wanted 3 sets of locked doors on a hallway. Obviously, we want to keep people out that don't belong in our schools. But these administrators were saying the chance of me having to evacuate 6-year-olds because of fire or a gas leak is also very important. And if I can't get kids out of the building in an emergency, I have problems there too. The people designing those policies, super well intended, addressing as Sandy said, a very specific problem that had happened, but didn't know anything about moving hundreds of 6, 7, and 8-year-olds at one time, right? So I started thinking, how do we help address the problem and problems that are gun injury and violence, whether they're in schools, whether they're in communities, whether they're in our homes? Like, how do we get to talk to people who are doing this work, who have to make these things work? And at that time, I should pause. I'm going to talk about a few partnerships right now. I cannot talk about all of the partners that are crucial for the work that we're all doing every day. So please know that I acknowledge this is such a complex problem that requires so many of us and so many different stakeholder groups, even though I'm only going to talk about 4 today. Okay. I just start talking. I don't pay attention to my slides. I should look up here too. So here is the partner list I had. I'm going to talk today about healthcare providers, a commonly called upon partner, but I'm going to talk about something that's a little bit different. I'm going to talk about gun owners, a not often enough called upon partner, but again, differently. I'm going to talk about developing partnerships with retail and insurance industries. And when I mean partnering, I don't just mean the doing. I mean partnering on the ideas, partnering before we decide that, I've come up with this brilliant solution that's going to fix things, right? Partnering early on. Okay, clinical care partnerships. So 2012, Sandy Hook happens. It is devastating and overwhelming and changing the way I'm thinking about where I want to work in policy. And same time, not long after, I was brought into a research group, public health group, because they wanted to create a new intervention for physicians to increase the frequency of what they call anticipatory guidance or medical education. So talking to people preventatively about firearm safety, specifically during well visits. And so I said, okay, my job in this project was to write the questionnaires and the interview guides that we would use to evaluate to see if this new great idea that was going to make all doctors talk about firearm safety to their patients before there was a problem work. And I said, okay, what do we know? So we know at the time that the American Medical Association had elevated recently firearm violence to a public health threat and increased efforts to incorporate firearm safety guidance, this came a little later, into medical school curriculums. We also knew from surveys that existed that few providers, so only about a quarter, and I've seen it numbers as low as about 10%, had these conversations with patients. And despite the fact, there was research that showed that clinical care providers could be very helpful in improving outcomes, right? They reduced car fatalities, they reduced rehospitalizations after surgery, they reduced or improved chronic disease management. We knew the strategy could work. So we know it's been shown to be effective. We know specifically in the area of gun injury prevention, there was research that showed when physicians or healthcare providers counseled adolescents about firearm danger, that self-harm went down from guns. And we knew few physicians who have made a life out of making people well, we're doing this, so why? So I said, well, have we asked physicians why they don't do this more often? And everybody's like, huh. Like, I didn't think it was just a regular question, right? Because I knew from my work with educators, based on a tool that I cite there, the user rating profile, or what we call ERP. The user rating profile is, again, a survey tool designed to ask users a bunch of information about what they know about a problem, how feasible they think the proposed solution is, do they think the solution's useful to their work, do they have the supports to do it, is it acceptable to them? These things will determine if an intervention or a policy is implemented well, and if that implementation stays, right? If people keep using it well beyond the researchers leaving and well beyond the news about the policy fading. And so they were like, okay, let's ask physicians and other healthcare providers. And we did 2 studies. The first these are qualitative interviews, so they're 45-minute to 1-hour conversations with healthcare providers. And we did about 20 of them, and we split up. You're like, this is random. We don't think about firearm research in terms of regions of America. My team, when I say we think about it in terms of policy context, right? So Connecticut may have way more in common, at least in terms of secure storage laws with Texas, than it does with Maine and New Hampshire. So looking at New England doesn't really tell us much, right? So we split our interviews with healthcare providers in 2 groups of states. One group of state had child access prevention laws, so laws that require weapons to be stored securely when there's children. And those laws differ by states, but the blue states all had them. And the red states simply do not have those laws, right? And so that way we could see, does the rationale that physicians are giving us differ based on the laws of the state? We also then did another 36 interviews, in New Jersey alone. Why New Jersey? In addition to the fact that they were willing to fund the work. So the first study was all general practice internists, so like family medicine, who you see for your well visits when you're an adult. And we thought, does this differ by stage of life or type of well visits? Do pediatricians think about this differently than those who take care of adults? And we were also interested in OBGYNs because many women of childbearing years see their obstetrician as their primary care person. And here's what we asked them. We asked them about the context and resources they had surrounding patient interactions, what they did cover during this medical education portion of a well visit, how comfortable and willing they were to talk about firearms, what they knew about their state laws, barriers to having these conversations, like why don't you, and then what would help you. And here's what they tell us. So everybody, when they start this, they're like, yeah, it's time. It's time. Everybody said it's time. It's not exactly what they said. They said there's no mechanism to initiate these conversations, that most of what they do is driven by the electronic medical record, or if any of you fill out a little questionnaire on an iPad, right, or your provider asks you a bunch of questions. Have you gone for this screening? Do you exercise? Do you drink alcohol? Do you smoke? All those things. They said there's nothing on that screener that puts this question about firearms in the home up there. So it just doesn't light up for us. We don't ask. So time is a problem, they said, and I'm going to talk about that in a little bit, but A, nobody had figured out how to make more time, and B, it doesn't matter how much time you make if you don't screen for it initially. And so just here's some excerpts about the lack of screening being a barrier, right? One obstetrician said, it's in some screeners that can be purchased, I just don't have that screener. Another primary care provider, on the EMR, there are quality measures that light up red if they're not done. And I'm looking at those in my, crunch to get through everything. They also said that professional association guidelines drive how they prioritize things. So physicians have way more things to take care of than they have time, The more we learn about how to prevent disease and injury, the more they have to fit in that medical education part, and they use their professional association guidelines to prioritize conversations. And then they said, there's no way to make a visit longer because there's no billing code, right? So this is all a great idea, but I literally don't know how to make this happen. And so the idea here is we went in thinking we were going to partner with healthcare providers to do something. And what we realized was we needed to partner with healthcare providers to help them do something if we wanted them to do, right? If we cannot create policy or space for billing codes, for guidelines, for requirements on screeners, there are some things that are standard on all screeners. We can't ask healthcare providers to partner with us on something we want to try out. I'm going to go. So what do healthcare providers need effectively? They need tools and training, right? They need the right screener, and they need additional training about what to do with the information. Some doctors said, okay, so I ask, but I don't know, what's the best information to give, right? Especially if they're not a firearm owner or user. What am I supposed to then give out or do once I've asked these questions? We need mechanisms to create time and space. They need people lobbying to change policy, especially policy that is around Medicaid or insurance requirements. And then they need help establishing a culture of firearm safety in healthcare. So if we get back to my, here's what we need, we're like, okay, they're super knowledgeable. They perceive this as being very useful, right, to reducing injury and death. They're totally acceptable. When we asked about comfort, a gynecologist was like, lady, I talk about uncomfortable things all day. It's literally my job. How I'm comfortable about things does not matter. But they didn't have anything that was stakeholder driven, right? Nobody had asked them what could work, it wasn't, all the solutions being proposed were not practically feasible when the researchers left the situation, and they didn't have the environmental supports. Okay. Now, partnerships for firearm owner informed practice. Again, this is the idea of not asking something from firearm owners, but understanding what's important and what they need and how they view potential solutions to create useful, usable solutions. I'm not even looking at my notes. Okay, so I shouldn't have to tell you about the benefits of listening to gun owners. We decided that the best way to do this was that we did about 40 in-depth interviews developing this survey. So we had 40 long conversations with firearm owners and non-owners around the country, because both are in this study. And we wanted a neutral survey-based tool so we could explore public perception, and then extrapolate that back to the larger population on themes of cost and accessibility for firearms, regulation and education, and recreational use. We understand, I say we, our team, and those of us like y'all trying to reduce injury, gun owners are not a monolith, right? And policy has to reflect that complexity and diversity. So we wanted to measure how people perceive a policy as being harmful or beneficial. There is no pro, there is no anti here. There is, I find this to be beneficial to me, I find this to be harmful to me, right? And we didn't ask about specific policies, we instead asked about policy outcomes. Because that's what it's not about how someone packages or sells a policy, it's about, do I find a policy that requires it to take longer to get to a firearm as being beneficial or harmful, right? Do I find a policy that has permitting requirements beneficial or harmful? And not that we necessarily determine policy that way, But it's super important that we think about that and we have that information when we're trying to figure out the logistics of implementing it and how we communicate it. So we started with 31 items or questions on an 11-point scale. I'll show you that scale in a minute. And we split them up by policy outcomes that restricted access to firearms and policy outcomes that are permissive, that expanded access. I told you, I don't do the anti or pro. There are policies that restrict who can use a firearm, where they can use a firearm, or put barriers. It costs more to use the firearm, right? That's an economic restriction. And they might restrict from certain classes of people, people with felonies, people with certain mental health diagnoses, and then there are policies that expand access to firearms, make it possible for more people to have firearms to carry in more places, that remove financial barriers, right? So we wanted to know both, and everybody can perceive those policies different ways. So we wanted a measure that allowed for that. And so we asked, I know there's a lot on the slide, this violates every good slide rule, but on a scale of 0 to 10, where 0 means completely opposed and 10 means completely support, so there's a little bit of a jump here that we see you oppose policies that are harmful, that you view as harmful, and you support policies that you view as beneficial, please rate the extent to which you would support or oppose a policy or practice that does each of the following. So, right, we don't ask about an ammunition tax, we ask about a policy that makes ammunition more expensive. And you can see those. And you know what? There's going to be a QR code. You're going to wait till you see what you can do with all this stuff. And these policies broke down. We used, I'm going to kind of skip the methods, but we used exploratory and confirmatory factor analysis for those of you who do that. And we found that the policy areas broke down in these 5 subscales. Policy is about firearm regulation, cost, and accessibility, which I just explained. Special restrictions, so people with domestic violence convictions, children, right? Permitting and education, continuing education requirements, relaxing restrictions, so people that, policies, outcomes that expanded access to firearms, and then policy outcomes that made it easier to participate in hobby and sport. And so you can see here, I'm not going to spend a lot of time on the numbers, happy to talk either at questions or after about this. These are the means. So 0 to 10 is the scale. So a middle, like a 4.72, is on the opposition side, right? Middle would be about 5.5. And for those of you who are interested, I included the standard deviation because it gives you a sense of the spread. So the policy to increase the cost to purchase a gun, right? The sample was more opposed to it than it supported it, but you can see it's pretty wide. So some people were very opposed to it, and some people supported it moderately to strongly. And so we asked about those restrictive policies, policies that limit the types or numbers of guns people can purchase, and you can see that, I'll get back there, policies that allow expanded access, so permissive policies we asked about too. One thing that's interesting, I think, about some of the permissive policies, like people with a felony conviction, people with a history of violent behavior, a mean of 1.97 means everybody is opposed. So even people who were strongly supportive of permissive policies expanding access didn't think all of these things were beneficial to them. More permissive policies, people with a domestic violence conviction was very low, but you can see a policy that makes it easier to participate in shooting sports, the sample on the whole saw as more positive than negative, more beneficial, and the spread isn't all that large. So some people saw it as very beneficial. Okay. So that's, I, again, can't drive. So that's interesting, right? We have this information about how people perceive outcomes. But what can we do with this? So we can look, and you're gonna be able to look at gun owners and non-gun owners. We can look at people who live in different states with different policy contexts, right? But we started to think, okay, what else? Well, we have measures in these data sets of people's experience with violence and victimization, both whether they've witnessed it and whether they've experienced it directly. And you can see we have a whole bunch. This is based on a trauma scale that's used with adolescents. So witnessing family violence, witnessing other trauma, witnessing physical assault, being a victim of physical assault, physically threatened, victim of sexual assault, through dating violence, right? We asked about whether or not people had experienced or seen these things in childhood, as an adult, or both. Oh boy, okay, good, I gotta go. So what we did was, we did a latent class analysis again, and what that does is it finds underlying things that different respondents have in common. And our respondents broke down into 6 groups: those with high exposure in childhood and adulthood, so people who have just had a lot of violence and victimization; moderate exposure in childhood with adult intimate partner violence; high exposure in childhood, but low intimate partner violence exposure as adults; moderate exposure, low IPV, and low violence and victimization exposure across the life cycle. Class 6, the low to no violence and victimization exposure, is about half of our sample, so half the population. And then we could look, how do these particular classes, how do people with these experiences feel about regulation, cost, and accessibility? I'm gonna go through these quick because I can get to the summary. How do they feel about policies that relax restrictions, hobby and sport? And do these experiences make a difference on their behavior? Does it change if they keep their firearms unsecured in their home? So I'll get there. Does it change whether they open carry? And here's what kind of blew my mind, even though it's probably not going to be all that surprising. I'll go back here. Darn it. Okay, so in all, the violence exposed half of the sample, so the people who were in those first 5 categories, they were more likely to secure weapons, report securing weapons unsecuredly, and they were more likely to report open carry or concealed carry outside of hunting and sport. But it was more complicated than that. If their violence and victimization was assault-driven, they were less supportive. They were more likely to see secure storage, policies that required secure storage. They saw those as harmful if their violence and victimization was assault-driven. If it was driven by intimate partner or family violence, they were more likely to see secure storage as beneficial. So we have this one set of policies that can impact a lot of different firearm outcomes. But we talk about them the same to everybody, right? Somebody who has a history of assault, who believes that they are safer without a weapon stored, should still store their weapon safer, but we can't communicate that message in the same way. That's not reasonable, right? It's completely ignoring why they feel safer with their firearm. So, real quick, this data, there's 2 waves. One was captured right before the Bruin decision in 2022. The other, we finished data collection right before the presidential or the national elections in November of 24, are both available on our website, the HBI data portal. You can get things like this where you see the distributions and the answers for each question, both graphically and by the number. You can also go in and select subgroups. So you can select by politics, you can look at gun owners versus non-gun owners, all sorts of stuff. By state policy. So the QR code will bring you to that website. I can also give it to you later, but there's 2 rounds of data that was made publicly available by Arnold Ventures. So people interested in learning about a policy or creating a policy or implementing a policy can go in and see, what are people going to think about that, and how can that impact how I partner with them and communicate and find shared space. Okay, I'm going to skip because I have to go fast. So we have 2 budding partnerships. Now when I say budding, these are very, very new, and we are still bringing people to the table. And one is with the insurance industry. Probably not the way y'all are thinking about. So I'm from Connecticut. Hartford, Connecticut is the capital of Connecticut. It is also, Connecticut owns 2 things: the insurance industry and college basketball. We can talk, friends, but it's just a fact. So we're trying to partner with the insurance industry on a number of different ways, right? So when I talked about physician partnerships, there's a need to partner with Medicaid and with health insurance companies. They bear a huge cost. Eric referred to the cost they bear on the cost of firearm violence. We have not figured out a way to have them help reduce that cost. It's in their own best interest, right? But they could do so through allowing HSAs, your health savings account dollars, to be used for firearms storage equipment. Like, why can't you can use it for lots of things? Why can't you use it to buy a safe to store lethal means? They could provide incentives. Insurance companies also play a huge role in normalizing our behaviors that mitigate risk. They're why we use seatbelts. They're why children are in car seats, right? I mean, a lot of it is about pediatricians pushing this forth, but we've used insurance to help incentivize people, right? Speeding tickets. People drive slower because they don't want their insurance to go up for getting a ticket, right? So I talked about how we could partner with healthcare insurers. Partnering with auto insurers. This is really new, and this is what we're working on now. So everybody thinks when I talk about auto insurer partners that I'm talking about the gun itself, right? More than half of the guns stolen in America are stolen out of vehicles. Many of you may know that. And so gun thefts from cars has also gone up tremendously. I'll show you. So the bottom sector, which if you can see is the brightest blue, is gun thefts from cars from 2013 to 2022. 10 is gun thefts from burglaries. It's pretty small, right? And then the darkest is all other gun thefts. More than half. If you look at 2013, look at how that has changed. And if you see, the rates also vary tremendously by firearm, secure storage laws, right? So we have, on your right, I couldn't teach a fitness class. On your right, we have states that Gifford has rated as an A or A-. So they have a number of restrictive firearm policies. And these numbers, the bars represent per 100,000, right? And then on your left, no, you're right. Anyway, the Oklahoma and Ohio, they have very permissive firearm contexts. Giffords gives them an F rating. Look at how many more guns are stolen from their cars than are stolen from states with secure storage laws, right? But so gun theft is huge, and people are losing their guns. They're getting into secondary markets, right? But homeowners insurance covers your firearm when it's stolen, right? And most homeowners policies have a pretty small cap. So in the insurance world, $5,000, $8,000 claim isn't that big of a deal. Also, not everybody is reporting that their gun was stolen from their car because either they not necessarily supposed to have that particular firearm, or they're in a state with secure storage, right? Some of these numbers may be that if you're living in Connecticut and your gun was stolen out of your car, you're not telling people that because we have universal secure storage laws. So a lot of things going on here. But still, when a gun is stolen out of the car, you're like, lady, get to the point. When the gun is stolen out of a car, the car can be damaged. The glass is broken, right? It could be taken for a little bit of a ride. It could be dumped somewhere. It could be banged up. Well, the auto insurer is paying those costs, and they are much bigger than the cost of the firearm itself. So we're trying to partner with auto insurers, including auto insurers and companies that have fleets of vehicles, right? If you can't lock a weapon in a car, like let's say a truck, right? Many truck drivers report having firearms. They're by themselves. They have, valuable merchandise, all of that. Well, when they're driving from state to state and the firearm laws are changing from state to state, they could be out of compliance and not even know. So this is why insurers should auto insurers specifically need to start caring. We have a few that are coming to the table to have the conversation. Right now, we're getting a lot of like, okay, but we'll see. So this is motivation. So here's what they said at first. Like, this is my favorite. On the topic itself, unfortunately, that one's outside of my area, but I'm not sure it's something we'd be looking to concentrate on, right? The industry cannot take on more liability, right? And I get that. And then loss from firearm claims is minimal. And I'm like, yeah, but car damage from firearm theft may not be. And so they're also now saying, well, we can't support a mandate, but, well, we can't do this, but. So this is evolving. So here are all of the challenges, right? This is all blue. There's low knowledge about the problem. The industry is not contributing yet to the conversation about potential solutions. There's some practical feasibility concerns. Not everybody thinks it's useful if they think it's not costing their company a lot of money, et cetera. Okay, so my last emerging partnership, again, very, very new, is partnering with retailers. And this is not partnering with retailers who sell firearms. Happy to partner with them too. This is different. We want to partner with retailers as part of shaping culture, right? Remember the physicians said we need a culture of safety, firearm safety in healthcare. So how do we work with retailers about their product placement, their marketing, to normalize the fact that secure storage devices are just part of safety? Specifically, child-proofing or baby-proofing your house. Right, so if you look at all of this is it was revised in 23, but I just took it from Pampers' website last week. These are all of the things that is in the baby proofing checklist. I don't see anything there about securing a firearm. And so our idea, and we're starting to talk to retailers, both big box and online, about like, why can't we just have firearm safes where you have baby gates? I will also thank my assistant ChatGPT for helping me make this picture. Right, like when you look at it that way, that doesn't look shocking to me. It doesn't look, it's like you don't want your kids to fall down the stairs and you don't want them to get injured unintentionally with a firearm or to injure someone else. It's not actually about anything else. So here's the challenge. One, knowledgeable people just don't, I get a lot of the like, that's interesting. We need retailers to partner. We need this to be driven by stakeholders. Also, we're working with, pediatricians who are very much a stakeholder here and have driven so much of the child safety improvements. Practical feasibility, it is practically feasible. We have to work a little bit with companies who have rights to certain product placement, but it's doable. But when people learn about it, they perceive it as useful. So I think once we get over the knowledge threshold, we can get over the perceived usefulness. We don't have environmental support yet. Some people don't necessarily find this acceptable. So we have a lot of work to do here, but it's just another example of how we're thinking about partnering differently to change ideas and thought processes. Okay, so this is when you're partnering, whoever you are, I encourage you to think differently about what it means to partner. About not necessarily asking people to do things with you, but asking them for their thought partnership in the beginning before you decide what to do. Thank you. Did I use too much of my time? I mean, I'm happy to take questions. I know I talked. Yeah. Right.
And you're not getting the same results everywhere else. In Houston, domestic violence has actually doubled during that time. I don't know if anyone is directly studying that. I have seen one study that young people were 65 are more likely to carry guns.
Yeah, there are people who study that. The question is about the impact of lighting on in communities, on reducing gun violence, and there's some research out, and some of it's conflicting. I don't study that. It is studied, and I can look for you at some point and get you some citations of like randomized control trials that. Yeah. Yeah, I can get you some. There are some people, and I can definitely connect you with some resources. You sure? So we asked. We asked those different questions, yes, and okay. So the question was about what we asked people about their trauma exposure and experience, and so we asked them about physical assault. We asked them about domestic violence. We asked them about intimate partner violence separately. So we had a measure of relationship. We asked them about random experience in violence, and we asked them about all of those things with a firearm and without a firearm. So I know I went through that really quickly. It was about 16 to 20, I don't remember exact questions about different experience. And so we were able, because of numbers, we had to group domestic and intimate partner violence together, which I get is not the exact same thing, but we do have that differentiation. Yes, it's a good question. So we asked all people. Yeah, so you're asking about our technique on how we reached different people. People were randomly selected for participation in the study. The first study was just over 1,100 people. The second study was about 2,500 people. And then we asked them to self-report these things. So we weren't looking for people with certain experiences. These are just the experiences of the people in the study. Thank you.
All right, thank you all very much. We're going to give everybody a 10-minute break. As we move forward for the rest of the afternoon, we really want to engage the audience, but half of our audience is online. And so we're going to ask everybody to write their questions down, and when you have written a question, just kind of lift it up, and we will come and pick it up for you, and we'll bring it to our speakers. Thank you very much. See you back in 10 minutes. I'm going to ask everyone to please take their seats, and we're going to get going. So let me start first with a thank you to Jennifer Deneen, gave that wonderful talk. And I think one of the things I really love about Dr. Deneen's work is this notion of like trying to think outside of the box about how to approach this problem, the notion of not just working with the doctors. Clearly, we have to be talking to gun owners, but thinking through insurance, thinking through other companies and how we can improve this approach to preventing gun violence is fantastic. So the rest of our day is really going to be focused on these phenomenal panels of speakers who have really dedicated their careers to working in various aspects of violence prevention. To make this work as best as possible, I'm going to rely on you, our audience, to give us the questions that you want to know. Because our people, half the people who are participating today are online, we're asking that you write your questions out and that you hold those cards up so that people can come around and pick them up. What we're going to do is each of these sessions is roughly 50 minutes. There will be a brief introduction. Each of our speakers will have a chance to speak about what they do, but we really want your questions to drive it. So please think them through, write them out, and as one of the people who's going to have to read these questions, please do it legibly. Our next panel is our first panel is going to talk about suicide. This is a tough subject. This is about as hard as it gets. And I am sure, I know, that there are people in this room whose families and friends have been affected by this. I know that it has been something that has affected. Is our mic still working?
Not right now.
Our people online probably can't hear me if the mics are not working. Okay, let's try to keep that on. Suicide has affected so many people, and it affects everybody in different ways. I know in my own family and friends we've seen this, and it's a hard subject, and I just want to acknowledge it up front. I want to frame this to understand the scope of the problem in the United States. There are about 49,000 people who will die by suicide every year in our country. 55% of these, 27,000, are going to be by firearms. While suicide is not unique to the United States, it exists around the world, the mechanism is something that is fairly unique in our country. And that, you may ask, well, why does it matter what mechanism they use? And the reason to understand this is to understand the true case fatality rate associated with firearm violence. So when most people, if they attempt to die by suicide in our country, they will try pills, overdoses. Anybody want to guess what the fatality rate is with pills overdose? 20%. Anybody else? 4%? It's about 2 to 3%. There are many reasons why it is 2 to 3%. One of the reasons is it's actually very hard to kill yourself with pills. But probably more important than that, you have an opportunity to pause, reflect, have regret, to reach out to a friend, to family, to call 911. And if you get to the medical facilities, we can almost always save you. If, however, the lethal means that is in your home is a gun, and that is what you choose to use, the fatality rate is 91%. That is a huge difference. There is no moment for regret. And so when you change the availability of different mechanisms, the fatality rates change, and that makes a huge difference. And we have seen this actually in other countries. We have seen this in England when people used to use carbon monoxide from the stoves as a mechanism to kill themselves. And when they changed the fuel source to one that does not produce carbon monoxide, suicide fatalities decreased. In Bangladesh, it used to be that organophosphates, a type of fertilizer that was used, could cause fatalities. And they were banned, and the fatality rates went down. And so this is important to realize. Guns are an important thing for us to understand. We think about mental health, of course, when we think about suicide, but it turns out that not everybody has an identifiable problem in front of their fatalities. And as a pediatrician who does this research, I've looked at this great in depth. So it turns out that when youth die by suicide, those who die not by a firearm, by other mechanism, have about a 60% rate of knowing that they have a mental health problem. But when it comes to guns, it's only 35%. That seems unusual. But not if you understand kids. A lot of suicide attempts for kids are because of momentary problems that happened. I failed a test. My girlfriend broke up with me. Everybody's making fun of me at school. And in that moment of distress, when they grab and think about hurting themselves, if they happen to go with those pills, they will survive. But if it happens to be that it's a gun that's available, they will not. And so that's the framing we need to understand this problem by. So with that, I'm going to introduce our wonderful speakers, and thank you all for being here. First is Archie Blair. He's a clinical research professor in radiation medicine in the Knights Cancer Institute at Oregon Health and Science University. He's a professor of pediatrics at the McGovern Medical School at the University of Texas, and a collaborator of the Institute of Health Metrics and Evaluation at the University of Washington. He's done incredible work in adolescent and young adult oncology, but he's also dedicated his time and energy to thinking about this important issue of firearm suicide. He has 5 decades of clinical research. He has over $80 million in NIH funding, and he's written over 300 original articles. Thank you for those efforts. Big shoes. Allison Shellman is a pediatric health psychologist and the director of the pediatric psychology program at Children's Memorial Hermann Hospital and the Department of Pediatrics at McGovern Medical School at UT Health Houston, where she also holds the title of assistant professor. In the Children's Hospital, she provides evidence-based and family-focused care for children and adolescents hospitalized with medical illness and injuries, as well as those admitted with primary behavioral health concerns, and she's on the leadership team for the Children's Memorial Hermann Hospital's Zero Suicide Initiative, aimed at eliminating suicide deaths among patients served by her hospital. She has special interest in interprofessional collaborative care and dissemination of behavioral health best practices, and she works in the pediatrics medical setting. Thank you. Angie Cummings is an assistant professor in the Division of Public Health Pediatrics at Baylor College of Medicine and Texas Children's Hospital, and has over 13 years of public health experience conducting research and evaluation in community, government, and academic settings. Her work includes the development and testing of tools and programs to strengthen families, including the Family Care Portfolio and Universal Home Visitation programs, and she evaluates both statewide and local. She does work in healthcare utilization research on children in foster care and children who experience suicidal thoughts and behaviors. She currently co-chairs the Houston Area Suicide Prevention Coalition Strategic Planning Action Team, that is a mouthful, and leads the Community Needs Assessment. Overall, she aims to improve the well-being of children and families with a focus on vulnerable populations and equity. And finally, Dr. Lawrence Thomas is the Director of the Integrated Health Services at Harris County Resources for Children and Adults. In this role, Dr. Thompson oversees the provision of various health services to children in foster care, including pediatrics, psychiatry, dentistry, and psychology. He works privately with the Houston Metro Internet Crimes Against Children Task Force. Dr. Thompson received his doctoral degrees in clinical psychology at the University of Michigan and is a licensed psychologist. His most pronounced expertise lies in the area of trauma, personality disorders, self-care, and child abuse, and he has provided expert testimony in hundreds of child court proceedings and was recently selected to serve as vice chair of the State Child Fatality Review Team Advisory Committee in Texas. My panel, thank you so much for being here. I'm going to have each one of you kind of talk a little bit about your work, and we'll dive into the questions, so thank you. Right from there.
Can we go in reverse order?
You can do it however you would like.
Yes, Eric asked me to introduce myself a little bit just this morning. That's always making it an impromptu possibility. Why am I here? I can think of a few reasons, if not more, why I'm here. First of all, the photo right above me reminds me of 56 years ago in 1969, my first cancer patient, Jimmy Mortensen, who's about the same age as the, I think, gentleman in that photo behind me, who back then was reaching for his mom's hands because there were very few, if any, firearms to reach for. And he was reaching for his mom's hands because as my first patient with cancer, I had to either inject him with chemotherapy into the spinal fluid, doing a lumbar puncture, or do a bone marrow, taking it out of his iliac crest or his sternum and his chest, or give him intravenous chemotherapy or blood or platelets. Innumerable times I would stick him. So he'd have to hold his mom's hand, not what you see above me. That's one of the reasons I'm here 56 years later. But back then, except for accidents, cancer was the #1 cause of death in children that young. And those accidents didn't include bullets. If they did, it's less than 0.1% a half a century ago in this country. So I'm here for that reason. I also am here because in my neighborhood, a 12-year-old suicided with his parents' firearm, and I know who his parents in healthcare were, or at least I got to know him after that happened. A 14-year-old, not far from the high school, is a freshman who was bullied, suicided near where I live. That's another reason I'm here. I'm also from Houston. I think you mentioned that, Eric. And when Uvalde happened, and 2 days later, the NRA met in this city, just 2 days later for their annual meeting, I felt about my old hometown in a way I'd never felt before. Another reason I'm here is because I'm also involved with the Texas Doctors for Social Responsibility, sitting at the middle table, and who've had me help them in 5 different settings in Texas, on the Rio Grande and the state capitol just last fall, trying to meet with your representatives and senators and staff and counselors and so forth. I'm also here because MIT, my undergraduate school, and the National Institutes of Health taught me how to do data analysis. And although you heard today from Sandy that the Surgeon General passed, was dismissed a couple months ago, reported in his advisory of a public health crisis that the #1 cause of death in the United States, and only in the United States, there's no other country in this world that's anywhere close to where we are, but the #1 cause of death was bullets up to the age of 19. But as a data analyst, I've now found it's up to the age of 25 in the United States because of the data that he used were a bit older. And in Texas, in Tejas, the upper age limit is 29, 1 to 29. So I'm here because I can do some of that, having been taught to do it in the past. Impromptu as it may be, that's where I'm at, and that's why I'm here.
Thank you.
Okay. I am Allison Shellman. As Eric said, I'm a pediatric psychologist at Children's Memorial Hermann Hospital and the Department of Pediatrics at McGovern Medical School at UT Health, just across the street in the Texas Medical Center. I had an organized summary prepared for you about the work my colleagues and I are doing to prevent youth suicide in the children's hospital setting. And then I thought, if I have 5 precious minutes to speak about the epidemic that is child and adolescent suicide in this country, what do I want to say? And so I'm going to say those things. We talk a lot, there's a lot of public discourse in this country about the relationship between mental health problems and firearm violence. And Dr. Bleier and his colleagues have made this point in print, as have others, but when we talk about firearm violence being caused by mental illness, we are taking attention away from the real issue between guns and mental health, which is suicide. And nowhere is that more acutely evident than suicide among young people. Suicide is the second leading cause of death for 10 to 24-year-olds in this country now after accidents. More than 20% of adolescents report having seriously considered attempting suicide at one point. 1 in 5. That number astounds me. And nearly 10% report having attempted suicide among high school students. So no doubt we need to be talking about how to improve access to mental health services for children and adolescents in our country. But I'd like to highlight Eric's point again that what the data show us is that the majority of kids who die by suicide, particularly those who die by suicide by firearm, do not have a previously documented mental health diagnosis. And so I make that point because when we think about these children, we often think about kids who are known to be suffering with depression or anxiety, maybe whose care has failed them. But we are more often talking about kids who are suffering in silence and who are falling through the cracks, or who are, as Eric mentioned, acting impulsively. So to that point, we have to be including in the conversation about suicide prevention, reducing firearm access for our young people. Young person's risk for suicide is 4 to 10 times greater if there's a firearm in the home. When a young person dies by suicide, 80% of the time they've used a firearm, a family member's gun. And when a firearm is used, suicide completion rates among young people are 90%. So access to a firearm means the difference between life and death most of the time. So this brings me to the role of the Children's Hospital. I would argue that nowhere is the problem of youth suicide more evident than in the walls of a children's hospital. We have huge responsibilities and opportunities to notice these kids, particularly those kids who aren't connected to care previously, and then to act. And so in the few minutes I have, I will talk about one of the initiatives that we've undertaken at Children's Memorial Hermann Hospital to try to address this problem. So we, in 2022, applied for and were awarded grant funding to establish a zero suicide program. So we're now in our 3rd year. The goal of zero suicide programs, which are implemented in children's hospitals and in other settings across the country, is to eliminate suicide deaths. And so we do this through a multi-pronged approach that involves a lot of different things, and I'll summarize those. So it's from the top down, engaging our hospital leaders in shifting conversations around suicide, so that this isn't a discussion that people think happens in dedicated psychiatric spaces and therapy spaces, but is something that is fundamental to caring for children in the children's hospital setting. We're training our colleagues to better care for kids at risk for suicide. We are always working to optimize our screening procedures so that we have universal screening for kids aged 10 and up in our inpatient spaces. We are treating these kids while they're in our hospital for a short time the best we can, and trying to engage their families in care, modeling for families how to talk about suicide. And I think this is a really important point that I hope I get to say something more about. Counseling families about safe firearms storage and how to keep kids safe at home, and specifically having conversations about securing firearms, and I will add to that safe medication storage using a harm reduction approach. Distributing free firearm locking devices, no questions asked, and then transitioning kids out of the hospital with a plan for care and following up with families to try to address barriers to care after discharge. So we have a team that looks at all of our data and is always trying to improve the services we provide, and all of that is driven by our commitment to a belief that the only acceptable number for suicide deaths among young people is 0, and that it's the grown-ups' responsibility to try to keep kids safe and alive.
Thank you.
Okay, good morning, everyone. I'm Lawrence Thompson. I'm the Director of Integrated Health Services at Harris County Resources for Children and Adults. I really appreciate the comments of all of the previous speakers. My oversight, the services, medical, dental, behavioral health that my team provide focus on children in the child welfare system. So these are kids in CPS-involved kids. These are kids without insurance. These are kids that are in child placement agencies, perhaps being adopted. These are unaccompanied minors. These are kids who all the disturbing statistics that you just heard referenced are even more adversely impact. We talk about things like having safe places or safety, secure storage for guns in a home so that a child doesn't have access to that. Some of the kids that we work with may be in multiple homes in a given 2 or 3 week period. And so, just securing guns in one home is one thing, but trying to secure them all these places that these kids are going is another. In terms of mental health and the trauma and consequences of that, these are kids that have been abused and neglected. And so to the extent that there is a nexus between them harming themselves and their mental health, they have a lot of challenges in terms of mental health. The other thing that I'm going to mention here today, I've really been heartened just already this morning by being in a room of like-minded individuals, totally committed to trying to keep our children safe. And I mean like-minded in terms of keeping them safe, but also fairly like-minded in terms of the types of things that we need to be looking at to keep them safe. As heartening as that is, you all, I think that some of us in this room need to challenge ourselves to sit in other rooms with people that maybe are like-minded in terms of wanting to keep kids safe, but have a different perspective on how to do that as it relates to firearms. I feel like our conversations are happening in two different rooms, and we need to figure out a way to have the conversation together. As committed as I am to all things that makes children well and whole and safe, at the same time, I'm an avid gun owner. I come from a place, y'all, I'm from around here, a little town called Raywood, Texas, but I come from a place, you all, where the first day of whitetail season is a holiday, okay? And so in that room, there are people just as committed to keeping kids safe and whatnot, but there's a lot of fear, actually on both sides, in both rooms, in terms of what the consequences are of paying attention to how to do that and paying attention to the voice of the other side. So that's my challenge, because as wonderful as it is to be here, we've got to get people from the other proverbial or metaphorical room that I'm talking about in here, and again, we got to spend time in that other room too. So that's my challenge to myself and everybody.
Thank you.
Good morning. Can y'all hear me okay? Okay. I'm Angie Cummings, and also I would love to thank my co-panelists for your comments and all of the work that you are doing, and just sort of add on to why I'm up here, or why I think I'm up here. So in 2022, as you all said, I'm an assistant professor with the Division of Public Health Pediatrics with Baylor College of Medicine and Texas Children's Hospital, and my work is very broadly in maternal and child health. And so, you know, being at a firearms panel is an interesting place to be. But I have some health services research that I've done in the past, and so when TCH was launching Zero Suicide a few years ago, I was a part of the data committee, so to help look at our data to see, you know, where we were with things just system-wide. And what we learned from looking at our encounters is that in 2010, we had 81 patients with a diagnosis of suicidal ideation, and in 2021, it was 2,250. Now, a lot of things happened in that period of time. We started screening. So, you know, there have been a number of things that have happened that have changed the context, but also just a huge increase in the number of patients coming through our door that we are actually diagnosing, you know, and this ICD-10 code being in their chart. So we know that's actually an undercount. And then in terms of children 5 to 10, so children who we're not even automatically screening for suicide or even necessarily using the PHQ-9, we went from less than 20 encounters in 2010 to over 200 in 2021. And again, that's the 5 to 10-year-old age range. And so, and these children may or may not have, you know, a mental health diagnosis, as you alluded to, Dr. Shellman. And so some of that information helped inform some of the work that was done in the Zero Suicide efforts in Texas Children's Hospital. And my work has sort of shifted to a more community-facing side, but that also has led me to join the Harris County Child Fatality Review Team. There are others of us in the room here who are on that team, and I co-chair the Strategic Action Planning Team for the Houston Area Suicide Prevention Coalition. And as a community coalition that launched a little bit over a year ago, so this coalition did exist in the past, and then it merged with the Mayor's Challenge to focus primarily on veterans, and then was relaunched in February of 2024. So in its most current iteration, we are conducting a community needs assessment. And so we have looked at the suicide deaths across our city. We also are conducting a workforce survey through which we are, it's still open, and so, anything I share with you today is interim. So interpret it with caution. But of the individuals who have responded to our survey, of the individuals who work directly with patients or clients, 70% say that they are trained in safety planning, which is wonderful. But 87% say they implement safety planning. So we see an opportunity to provide some additional training and support for people who are doing safety planning with individuals who have screened positive for suicide and need an assessment. But then when we ask about counseling on access to lethal means, 30% have been trained in CALM. And so that's an opportunity for us here, because we know, as healthcare providers, many of the children who are coming in, there may be a firearm in the home, and we need to have a good sense of how do we talk to that family, how do we talk to that child, how do we talk to those parents. And so we are looking community-wide at opportunities. What are the strengths that we already have in place, and then what are some opportunities that we have? And these are just a few of them that we have identified so far. And Dr. Thompson, we are also conducting what we're calling community conversations. And so, because we know that, as much as we would love to believe that everyone is going to answer our survey that we, painstakingly developed with a group of people and vetted and translated, et cetera, that's not going to happen. And so we have started these community conversations with very specific groups in the community to hear from some folks in the entertainment industry. We had one with Houston Young Lawyers Association. We've had another with a group from Baker Hughes. So really trying to learn from different groups of folks who may not be in this room, who may not, who may have different ways of going about it, but still want to keep, kids safe, and still want to keep their friends and family members from dying by suicide. And so, I'm excited to be a part of this community-based work and really start to both support folks in the healthcare field who are, addressing individuals who are at need, but also starting to work more upstream in this work. So.
Thank you all. So I'm going to ask questions, and I'll target them at the individual speakers, but I invite everybody to kind of join in and have this discussion, and I've already gotten some questions here from the audience, which is wonderful. So Dr. Shulman, I'm going to start with you. There are a rising number of children being diagnosed with depression. The suicide rate has gone up. Do you see anything that is contributing to this as why we're seeing this in our country and in Texas? And specifically, what is the role of firearms, and thinking about how we should be trying to engage in child access prevention, specifically in Texas?
Oh boy.
Big questions.
Big question. I'm not familiar with what the current data are saying, but I can summarize my familiarity with the data in the last few years since the COVID-19 pandemic, and certainly my own anecdotal data from my work in the children's hospital setting. That I think there are a couple key things that seem to be contributing to increasing mental health concerns, including depressive symptoms among kids and adolescents. The kind of obvious targets, I think, are targets for a reason. One being increase in use of screen time and social media. Really with the problem being the social isolation that comes from having decreased social engagement in activities with other kids and more time alone spent in a solitary activity. I'm sure that exposure, there are people who are better equipped to speak to data about what kids may be exposed to in social media, and that's not an area of expertise for me, but certainly we need to be concerned about our kids sort of diminishing social connectedness. I think that's a huge problem. With regard to firearm access and increasing rates of suicide, is that what you were asking, Dr. Kugler? You know, I practice in Texas. We are a predominantly firearm owning state, and certainly in our children's hospital, we see a great number of kids who present with suicide attempts by firearm. It's actually those kids, in terms of numbers, fall behind kids who admit to the hospital after ingestion overdose attempts. But I think one of the important points there is that we don't see a lot of the kids who attempt suicide by firearm or complete suicide by firearm because they don't admit to our inpatient floors because they don't make it. So the lethality of firearms as a means in suicide generally, and particularly among children and adolescents, is a huge topic of conversation among our Zero Suicide group, but also something I think we all need to be talking about.
Thank you. Thank you very much.
Can I ask?
Please.
Yes, to add to Allison's point, a study was done on a randomized basis of children in a room that had a television screen but was not meant to be a primary target for their attention. They had other toys to play with. But on that screen in the background, they either were seeing a bland event, or they were seeing how to shoot firearms, a game that was being played in the background. And then when they walked outside the room after a defined interval, their exposure in the outside room was various toys, one of which was a firearm. And you can guess that the ones that came out after what they saw on the screen, even though it was passive, it was not meant to be primary, they played with that firearm. That's what they wanted to do because of the social experience in the screen, whether it's this one or a bigger one. That's a randomized control study done by very good pediatricians. I just can't remember where they were in the United States.
Thank you. We've had so many wonderful questions come in from the audience, so I'm going to jump right into these, and please, for whoever wants to pick them up. So the press reported record hospitalizations for Houston area students in mental health crisis. I will tell you this is not just in Houston, this is nationwide. What are some proven school-based programs for suicide prevention that parents can propose to their principals and other hospital administrators? In other words, what programs work in schools, and how can the parents actually help get these potentially occurring? Any thoughts from our panel?
Well, I'll reference one thing that works. One thing that works is having school psychologists in the schools. But with funding, the funding crisis, I'll say, as it relates to our schools, unfortunately, our administrators end up having to choose between, in some cases, mental health professionals or teachers. That's a hard choice. My brother is a principal. Hard choice that he has to make. And he can probably have two teachers for the price of one clinical or school psychologist. So these are the kinds of choices we have to figure out a way, especially I'll say in a state like Texas, where there's enough money for us to be able to afford to have a psychologist in our schools and all the teachers that we need. So we have to fund that and make it real. But at this point, there are some school districts that don't have any psychologists or even social workers in them. And you need people with that expertise, specifically as relates to suicide and firearms and all these things that we're talking about, that the school and the parents of the children can access immediately. And that's not the case.
I don't know if anyone in Houston is implementing it, but I recently heard a presentation about Sources of Strength, which is a school-based program that can be implemented in high schools where there are a group of peers who are trained in, they have shown a reduction in suicide. I need to verify that research, but I think they have shown a reduction in suicide deaths, but they really focus on having these peers who are supported by, faculty and teacher sponsors, and they'll do campaigns in the school, where they'll have they'll compliment a friend, but then they've also got these peers that you can turn to, so this is like a trusted person if you are having a problem. This is somebody who is trained to listen and also to know where to refer you to, know who can get you some help if you need some help. So it's really about, again, having those peers, but having a culture in the school that is promoting connectedness, that is, promoting the school as a place of safety and where people have a place to turn. So I think, again, thinking some of this upstream and primary prevention, that's also where we need to be, attempting to focus some of our efforts. And I know funding is always a challenge with those, but that is at least one example of a program that's out there.
We've mandated having armed personnel in our schools to keep our kids safe, which, hey, I'm sure we have folks that feel one way or another about that here in this room. But alongside doing that, we need to be mandating having mental health professionals in our schools to help when crises arrive, but also to help keep the crises from coming to bear in the first place, in terms of the ongoing health and wellness support that our children need and we all need.
I want to go back to the 12 and 14-year-old that I mentioned who suicided with their parents' firearm. One of the parents I worked with at the hospital, and the other one was also in healthcare. It turns out that the 14-year-old was under school counseling and was seeing a school psychologist at the best, and that's an adjective I should be careful to use, the best, quote, high school in my neighborhood. And yet suicided. One thought I had, and we just did this, is for you to elect representatives and senators and other governmental officials who are interested in the school problem, and we just did that in Oregon. And we hope she can have an effect, because unless you get politics involved, you are stuck.
Thank you. This is a question that came in for Dr. Blair, but anybody's allowed to be, please leap in. There is consideration of raising the purchase age for long guns in Texas from 18 to 21. And at the federal level, there is a limit on purchase from licensed firearm dealers of handguns of 21. But there's a loophole that from 18 to 21 in Texas, you can purchase from 18 to 20, I should say, you can purchase a handgun from an unlicensed dealer. Is there any data to suggest that this would be something that if limit was raised there for up to 21, that could make a difference?
Not on the licensed person or office or business or sales department, but in general there is. And some of this was published in 2021, now 4 years ago, in the Journal of the National Medical Association, and a number of us in this room were authors, Dr. Estrada, for example. But it's also contained in the brief called the Baker Institute Centers for Public Policy brief. And this is now online. Thank you, Sandy, for doing that. For those of you who are watching from outside, you can do a search for Baker Firearm Brief, Baker Firearm Brief, and you'll find it. And I've got a copy of it here. It's not just brief, it's like 11 pages and 7 or 8, 9 figures. But the answer to what I've just been asked is about the license dealers, so forth, is meant to be in here. Dr. Yasir Rahman and Jaime Estrada, Sandy, and I are authors. Let me tell you what one of the pages says, that for the states, and there are 28 in the country that have 18 as the minimum age, we've looked at the firearm suicide rate in those states, and it's doubled, if not more, than the states. It's actually more than doubled, and statistically significant, very so much so, than the states, the other 22, who have 21 as the upper, or the minimum age, I should say, to purchase a firearm, whether from a dealer or license or not. Now you can look at the states that have 21, the higher age level, and divide them up into 13 that require it only for handguns, or the other 9 that require it for all types of firearms, long guns, handguns, shotguns, rifles, shotguns, so forth. And there again, the statistical significance of the lower firearm suicide rate, especially in 18 to 20-year-olds, which is what's in this brief, and now we've updated it, and it's 18 to 25-year-olds. I'm going to say this twice. The highest firearm suicide rate in the United States under the age of 70, a lot younger than me, under the age of 70 is an 18 to 23-year-olds, killing themselves with bullets more than any other age, and especially in the states that are age 18 minimum to purchase a handgun. If they're age 21 minimum, it's half the rate. It's still going up in those states, but nowhere near as fast as in Texas and other states that have 18. And especially in those states that don't allow all types of firearms until you're age 21. And I can document that in some ways that we could do later, but
Thank you.
that's the answer that I can give you here.
Okay. There are a number of questions that have come in with regards to children and adults who live in rural areas. And what is the role of thinking about either access to firearms, or just what type of intervention should we be thinking about specifically for those communities? Anybody on the panel?
I don't know, I may be the only one on the panel from the country, so maybe I'll say something. My little town, we still don't even have a stoplight in it. I'm proud, actually, to say. But we do have to take a measured or a specific approach related to things rural. I mean, I grew up in a place where in the school parking lot, there were rifles, mostly, might have been rifle, shotguns, depending on the type of hunter the kid was, but they were in the parking lot, at the school, the whole time. And so, that was there in the truck, and there were fights at the school or whatever and whatnot. Nobody ever walked to their truck and got their gun, and went and settled it that way. But the guns were readily available. I mean, like right there in the truck. And then people a lot of times didn't even lock their truck. Well, nobody went and stole their guns out of the truck and whatnot. This is the school parking lot and whatnot. And so I'm not sure really the answer to your question, other than to say there's something that some of those small communities had when I was growing up and still have to this day that is inoculating, protecting them from some of the challenges that we're seeing as relate to gun violence. Now, I'm not saying that in rural environments we don't have some of the same challenges, some of the same issues and whatnot, but some things that, like the access issue, was there in a much larger way and had much less problems related to firearms-related injuries. And so I do think larger cities, big cities, for example, need to spend some time in another metaphorical room, so to speak, like I was talking about earlier, talking to our more rural environments in terms of what's working or not working and everything there, and vice versa. So I think that's just a unique and different way of us learning, framing the problem, and thinking about how to make it better.
I want to add that because I said under 70-year-olds, the highest firearm suicide rate in the United States is between the ages of 18 and 25 or 23. But over the age of 70, the firearm suicide rate goes up rather dramatically. It's almost exponential. So next year I'll be twice as likely to do it as this year or something. But especially if I live out in the country. And in Oregon and Texas, there's data to support that. The firearm suicide rate in the older population out in the country is dying of bullets deliberately.
Thank you all. As a reminder for everybody, I have a quick show of hands. Who knows the phone number 911? Everybody here. Who knows the phone number 988? About half. 988 is the National Suicide Hotline. It's an incredible initiative that has taken the patchwork of important people across our country and made it available no matter where you are in the United States. You can be connected to somebody. It's an important number to share with your loved ones and friends, and it's an important number to realize that people no matter who they are, no matter what their background is, they have access to it. To our wonderful panel, thank you so much for being here today, and we really look forward to continuing this discussion. I think we have a 10-minute break. Katarina, you're my boss. Where's Katarina? 10-minute break.
Hello, everyone. What an amazing panel that was. I am so excited to continue to bring this work to you today, and thank you for your engagement and your passion. We are going to continue on with our esteemed guests, and we're going to be talking about community violence. Public safety is the backbone of society. And when we think about firearm violence, I think what most people will jump to is this concept of community violence. You know, when we think about our safety, we start thinking about how can we protect ourselves. A lot of firearm owners, and I'm one of them as well, so thank you for sharing, Dr. Thompson. I'm a firearm owner as well. I like to go target shooting. That's like our hobby and our family. But I think a lot of firearm owners, when they report, why do they own? It's for personal protection, right? They want to keep themselves safe. They want to keep their families safe. And that's what's driving them, because they're worried about these interpersonal events. They're worried that someone is going to harm them. And what we are talking about today is how can we help understand when these events of community violence happen? How do we respond? How do we reduce them? Firearms are involved in 79% of all homicides. 79. Gun violence is a leading cause of death for Black males aged 15 to 34, and the second leading cause of death for Hispanic males of that same age group. Black Americans are nearly 14 times as likely to be killed by firearms than white Americans. We have some disparities here. We're going to talk about a lot of programs today that can impact change. Violence interruption programs. Houston is really lucky. We have several, and they're all in various different stages, and I'm really excited to bring our amazing panel here of our speakers who are going to share a lot of the evidence and the science and their programs. So without further ado, I'm going to talk about our speakers today. I'm excited because I know many of them. So first of all is Dr. Alexander Testa. He is an assistant professor with UT Health Houston School of Public Health. His research specializes in the prevention of crime and violence over the life course with an emphasis on firearm violence. Dr. Testa has authored over 280 peer-reviewed articles, and his research has been supported by local, state, federal, and philanthropic organizations. Presently, he is the principal investigator of a study funded by the National Institutes of Health developing a hospital-based violence intervention program for victims of firearm violence here in Houston, Texas. He holds a Master's of Public Policy from American University and a PhD in Criminology and Criminal Justice from the University of Maryland, College Park. Welcome, Dr. Testa. Dr. Howard Henderson is the founding director of the Center for Justice Research and a professor of justice administration from the Barbara Jordan Mickey Leland School of Public Affairs. He is also a non-resident senior fellow in governance studies at the Brookings Institution. Dr. Henderson serves as an advisory board member of the VERA Institute's Rural Jail Research Policy Network. That's a lot to say, guys. Let me just say. He does a lot of stuff. I'm like reading like, oh my gosh, it keeps going. A member of the National Scientific Advisory Council at the Institute of Justice Research and Development at Florida State University, and a member of the National Science Foundation's STEM's Opportunities in Prison Settings Work Group. He is an expert on culturally responsive criminal justice research, program evaluation, and predictive bias. He served as the chair of the Data Subcommittee for Houston's Racial Ethnic Disparities Committee Data Work Group, supported by the MacArthur Foundation. His research on predictive bias and program evaluation has been supported by the National Science Foundation, the Department of Justice, and most recently, the collaborative efforts on the Center for Advancing Opportunity, Thurgood Marshall College Foundation, and the Charles Koch Foundation. He serves as an advisor to local, state, and federal legislators and a host of criminal justice agencies, along with reform-oriented organizations. He received his bachelor's in criminal justice administration from Middle Tennessee State University, his master's in criminal justice from Tennessee State University, and his PhD in criminal justice from Sam Houston State University in 2006. Go Bearcats. My daughter's there right now, that's why I say that. We also have Dr. Cherie Berry, who is an acute care and trauma surgeon with Extant Healthcare. She also serves as the regional trauma medical director for HCA Healthcare Houston Gulf Coast Division and the trauma medical director at HCA Healthcare Houston Northwest Medical Center, where they launched Houston's first hospital-linked violence intervention program in collaboration with Harris County Public Health Department in 2022. She is a busy lady, okay? She's also an assistant professor with clinical sciences in the Tillman Ferretta Family College of Medicine at the University of Houston. She serves as the vice chair of the ACS Committee on Trauma for the South Texas region and participates with the injury prevention, advocacy, and education pillars. She's an active participant in the iSave work group with the Committee on Trauma, where they focus on social drivers of health to attenuate firearm violence. Prior to being on the chair of Trauma Committee on the Southeast Texas Regional Advisory Committee, or Council, she was the medical director for the Injury and Prevention Committee. She's a native Houstonian, where she obtained her bachelor's in neuroscience at Claremont McKenna College, medical degree at Albany Medical College, her surgical training back home at the Michael E. DeBanke Department of Surgery Residency Program at the Baylor College of Medicine. And then we also have Lupe Washington, who served as the first director of the Community Health and Violence Prevention Services Division with Harris County Public Health Department since 2021. Her first year with the department, she oversaw the launch of the new division with 2 programs addressing violence from a public health perspective: the Holistic Assistance Response Team, HART, and the Community and Violence Interruption Program, RISE, which stands for Relentless Interrupters Serving Everyone. Prior to joining the Harris County Public Health Department, she worked for over 24 years as a juvenile justice practitioner, with over 20 of those years in management. In January of this year, Ms. Washington and her division oversaw the successful transition of the HART program to a fully operational Harris County 4th responder model. I'm excited to hear more about this in a few minutes. Her team has celebrated the ribbon cutting for the first empowerment center in the Cypress Station area in Harris County. She earned her bachelor's degree in Latin American Studies and psychology from Mount Holyoke, thank you. Y'all know that. I was like, I'm gonna need some help with that one. And her Master's of Science in Criminal Justice from the University of Houston downtown. She is among 31 leaders from across the country selected to participate in the inaugural Community Violence Intervention Leadership Academy cohort through the University of Chicago. Y'all, we have an amazing team here. I'm really excited about this. All right. I'm going to join this team down here, although I don't think I'm fancy enough for them. So, all right. Now, to get us started, let's talk about where things are currently in the region. I'd like to start with setting the stage. What does community violence look like in Houston? And I'm going to tap Howard to start us off to speak about the trends of community violence over the last few years, and then have the rest of the panel jump in after that. So set the stage first, Howard. What is it looking like right now?
Yeah, thanks again for putting on this panel. I appreciate it. Somebody's got to give me one of these orange shirts. I need it right now. I just took a 45-minute hike around the construction trying to find my way, but we made it. Interestingly, I got a chance to see an archery program this morning, and so I appreciate the opportunity. But let me paint the pictures if I can. So far this year, homicides have surged almost 21% in Houston, with 55 deaths noted as of June the 2nd, mostly by firearms. And we're projecting, if it's consistent with what we know for past years, 130 by year's end. Across the country, over 6,000 lives have been lost to guns this year, including 100 children and 418 teens, with over 10,000 injured. Every day, 125 Americans are shot dead. In black communities like Houston Sunnyside community, face gun homicide rates almost 10 times higher than those in white communities. That's a 26 per 100,000 rate relative to anyone else. These numbers aren't just stats, they're lives, families, and futures destroyed. Our research at the Center for Justice Research at Texas Southern University reveals why. We examined over 100 U.S. cities, and what we found is that unemployment in zip codes like 77026 fuels shootings, as economic despair breeds violence. Young black men, like the 357 that we studied across the country, carry guns not out of choice, but fear. Trapped in neighborhoods they describe as war zones with few communities. Systematic inequities, poverty, segregation, and the housing burden amplify these crises, costing our nation over $280 billion a year, with each gunshot wound draining up to $1 million in care. But I don't want to end on doom and gloom, right? I want to sort of end on a high note. Houston's community violence intervention programs are actually making a difference. They're cutting shootings with 128 non-fatal shootings this year, down slightly from 2024. Scaling these programs, paired with jobs and better data, can save lives. And today, with experts on this panel, we'll try to explore data-driven, community-led solutions that can break this cycle. Let's make Houston a model for safer communities, starting now. Thank you.
Excellent. So we have the benefit of having 3 different hospital-based violence intervention programs represented on here. So I'd love to explore where these models are. And I think we've got 3 excellent people to speak about them. So I think we'll start with Lupe, and then we'll work our way inward, if that's all right.
Sure.
Excellent.
Good morning, everyone. Well, fortunately for us, we were in the works of drafting an agreement with Ben Taub Hospital to launch our first hospital-linked violence interruption program. And then we got a call from Dr. Berry asking us if we would like to partner with them. And all they were asking was for the partnership. Like, can you bring the program here? We're ready. And we had an agreement executed within 4 months to launch our program. And so we were able to start at HCA Northwest on November 1st, 2022. And since that program has launched, our team and our hospital outreach specialist is here today. At HCA Northwest, the team at bedside has met with 290 victims. And we serve victims of gunshot wounds, aggravated assaults, and stabbings who come into the hospital. Dr. Berry and her team obtain consent from these victims to be able to participate in our program, or just to give us that permission to meet with them. And upon that agreement, Ms. Andrea will go and meet with them. We do have a certain time frame to be there, 90 minutes. She's probably there in a lot less time than that to get to them at bedside. But we don't just deal and work with the victim to help them. We work with their family. There have been instances where she and the team have had to prevent retaliations from happening, prevent instances and guns from going off in the actual hospital room. And so our team is skilled because, number one, they come from these communities that we're serving. They're familiar with the resources in the area. They are heavily invested in these communities, and many of them have and share the same lived experiences as a lot of the victims and the participants that we're working with. And so we were really glad to be able to launch that program at HCA Northwest. Dr. Berry continues to be our champion there. We look forward to continuing our partnership and really growing the program, in different facets. And then we were able to launch the program at Ben Taub Hospital in May of '23. And so we were fortunate there. We do have a social worker who's at Ben Taub. They also obtained consent. And since program launched, we've met with 385 victims at bedside. Again, same concept. The beauty of our division is if there's somebody who comes into the hospital that perhaps is an individual at the highest risk of being the perpetrator or victim of crime, we can also bring in our violence interrupters. And they surprised me today by coming in. So we have our Southeast team here. Guys, stand up. Yeah. Thank you. And then Miss Andrea and Miss Manalda, y'all can please stand up so they can know who you are. They work the hospital program. And so what we can do is if there's somebody at the hospital that is really gonna need that immediate intervention, we can just pull the team in to come in and have conversations. Again, it's about establishing rapport where we're not there to judge. We're there to see how we can advocate and what resources we can connect them with. The goal is, number one, to prevent re-entry into the hospital, but also to give them and help them get the resources to have a successful recovery. So again, we're very fortunate to have the support and that we are a priority program for Commissioners Court of Harris County, with having the RISE program. And so both the hospital and community programs are known as RISE, and we are relentless interrupters serving everyone. And so we're very fortunate, and since the program launched with the community violence interruption efforts, so we are in Sunnyside, we are in South Park, we are in the greater OST South Union area, and then we're in the Cyber Station area as well, where our new RISE Empowerment Center opened. We are looking for a location for the southeast area of town so that we can open a second RISE Empowerment Center. And since we launched the violence interruption program in the community, the team has prevented over 100 instances of possible gun violence. And so when you calculate that, and you look at every town for gun safety, their calculator per state, it's in the millions that we've saved the state of Texas. We know that the dollars, it's not just the hospitals, but the costs that come after that and with recovery. And so again, we're just really fortunate. And then our leadership at the department, we have our interim executive director here, Ms. Leah Barton, who continues to be a great supporter of what we do. We just love what we do. We have a passion for the work, and a goal for the work is to hire the right people from the beginning.
I think one of the things that you spoke on was that I hang with is you have a passion for the work. I think that's key. This is passion work, right? This is mission work, and I'm a big mission girl. Like you have to have passion, you have to have your mission, and that's where the heart is. And I think that's the only way that you can make a difference in this world is if it's your heart work. Mm-hmm. And so, Dr. Berry, I'd love for you to talk a little bit about how the implementation of the program has worked in your place, and especially being a surgeon, I don't know how you have time to even be involved in this program, knowing all the different hats that you have to wear as well, and how this program even came to be where you are.
Thank you. You have no choice. So as a trauma surgeon, this is not the reason I went into surgery. However, the way our partnership started, we were looking, so a couple of things. So we were looking at our data. It was brought to our attention that, you know, we were operating more than the other, our sister facilities. And the type of operations we were doing were because of penetrating trauma. So we had 3 times the national average for penetrating trauma at our center. That was an outlier, especially given that we're out of the med center. And so we started looking at that data, and when we started to really do a deep dive, we also noted what we all know of the cycle of violence. So we saw a rate of recidivism. So we were having patients coming in up to 4 times for violent-related injuries, that same patient. And so my trauma educator at the time, who had had some experience with violence intervention back in California, she said, we have to do something, and we did have to do something. So as a trauma surgeon, it's one thing to be able to surgically repair wounds. It's another thing to be able to constantly have to watch children, because these are not all adults, right? And children and adults coming in for injuries that are devastating, not just to the patient, but also to their family, who now, if they make it, have to become caregivers and change their entire life, which also has an impact on the community, right? So as a surgeon, we're involved in this somewhat at the bedside, kind of watching this unfold in a very traumatic, emotional experience in the ICU. And those are the ones that are actually lucky, right? Because the other ones, it's a very short experience in the ER, or maybe after I talk to them in the waiting room. But anyway, after having to deal with that, you know, I felt as a healthcare provider, you know, part of trauma is not just operating, it's also about injury prevention. So really my goal is try to make sure patients never really have to become patients. And so as a healthcare system, we said, what can we do to try to mitigate this at the front end, to decrease the number of patients that are coming in for these injuries, since they are preventable, to reduce the recidivism, so the same patients coming in for the same problem, just from a human ethical standpoint, but also from a resource standpoint, because I think, as you mentioned, which I think escapes some people, is the cost of all of this, for the individual, for the family, for the community, but then as a healthcare system, and then as a country. So anyway, that's how we ended up partnering with Lupe, and we were like, we need to do this. This is immediate. Any partnership that we can do, and it just so happens Houston Northwest does sit in the Cypress Station area. They had already did the research noting that that was one of the top 2 areas for firearm incidents and injury, and so we were able to partner, start the program. Andrea, who comes into a hospital, is just, I can't say enough good words about her dedication to our team. But what we noted in the implementation of the program, and what we had to change kind of early on, because we came up with the criteria, was the age of the patients. So initially, it was going to be for 18 and up, and pretty early on in the process, we realized that we were going to have to change some things and bring that down. So we treat 15, we're an adult trauma center, but according to the American College of Surgeons, we can treat 15 and up, and so that's what we treat, and so those are the patients that we also have to include, given what we've been seeing. We also implemented, we realized that we're going to have some language expansion as well, so that's a change that we noted. But I will say, in terms of the impact, so we're just looking at the raw data. This is a shameless plug. We're looking to hire a researcher, anyone that's interested in trauma research. But just looking at the raw data, we have seen a decrease in the recidivism since 2022, because before it was in double digits each year, and that's come down. And we had 1 year where it was 0. So that's all raw data. I wouldn't say, you know, I can't say that it's only because of hospital linked violence intervention program, but I also know that our community violence intervention program has had an impact on that as well. So I'm excited about the future. I will say, looking toward the future, in terms of violence intervention, from what I see and the numbers that I've also read, we really need to get to the kids in middle school. Waiting until high school is almost too late. 2 weeks ago, my 15-year-old that actually shot himself on accident, he already had a felony. So that was his number one concern, was about this injury and what his probation officer was going to say. 15. Dad didn't know that he had a gun. That was 2 weeks ago. So getting to the patients earlier, I think elementary and middle before 8th grade, and then the mental health resources. So having resources for those that are uninsured following their hospital discharge, just more robust in terms of the PTSD, the counseling for the families, as well as some conflict management kind of training, I think would be the key things moving forward.
Excellent. And I think you really kind of nailed in on some future things that I want to raise back up with you, but I'd love to have Alex talk a little bit about, Dr. Testos, share with us where your program is, because I know you're in a little bit of a different stage, and the approach of your program, so that we can learn about all the different aspects that are happening in the greater Houston area.
Sure. Super exciting to hear about all the great work that's going on and the coordination. So our program is based out of Memorial Hermann Hospital, Texas Medical Center, which is one of the other level 1 trauma centers here in Houston, Texas. We have a focus on gunshot wound patients, specifically aged 16 to 35, which is the highest age range that we see of gunshot wound patients coming through the adult trauma center. Those under 16 are treated at the Children's Memorial Hermann Hospital. And we're also focused on gunshot wounds that stem from community-based violence. So our program is not intended for people with unintentional injuries, like unintentionally shot themselves or suicide attempts yet, but I think in the future those are also important things. Our program is new. We were very fortunate to start this program due to support from the National Institutes of Health. So this is a program that had been long desired from people in the hospital, but sure is understood by everyone else. These programs are not free to start up. They generate a large cost savings, but there is a startup cost, and sometimes cities, counties, hospital systems might be a little bit hesitant to inject that startup cost. So in September 2023, we received a grant from the federal government that allowed us to start that up. And it was a very fortunate grant because it gave us about a roughly 2-year planning and pilot trial period, followed by a 3-year evaluation period. So where we're at, what we've been doing, spending the last couple of years, is learning from the community and kind of from the people with lived experiences, as well as people who serve on a community advisory board made up of community leaders, religious leaders. Dr. Henderson himself is a member to get academic expertise that helped us identify what are the key needs of individuals in that program. And starting in January through March this year, we launched a pilot study of that program where we successfully recruited 80% of people that we approached. I'll give a shout out to our program manager, Arisha, and our case manager, LaTanya, right there. Arisha every day screened the electronic medical records for everybody who came through with a gunshot wound so we could track them. And LaTanya went at bedside and met them. So to kind of explain our program, that's where it kicks off. We identify them in the hospital. Once they're medically stable, a case manager goes in at bedside and meets with them, talks with them to build kind of trust and rapport, which I think is the big first step, putting yourselves in somebody's shoes. They've just been shot, they've woken up in a hospital room. There's all sorts of terror. They almost lost their lives in many circumstances, and I think they know they have a long road of recovery, but it's also an opportunity of a moment of clarity for a lot of people, right? That, that bullet hit you here, but it could have hit you here. And that, half an inch, 1 inch is the difference between you having a second chance and you not having a second chance. And I think that kind of, is one of the reasons we got over 80% of that people who said, yes, if you're offering help, I will accept that help. What we do in our program then is we offer 6 months of case management services in which they meet with our case manager, and we kind of go through them with a kind of a structured assessment of what their most pressing needs are. And our kind of theory is that there is these underlying factors that perpetuate the fact that they probably got shot in the first place. And if we can try to help resolve some of those underlying factors for them, their most pressing and immediate needs, we'll put them in a safer circumstance while they're back in the community and re-entering. And so they meet with their case manager and do an assessment of those needs. And in that period between our case manager and our team, work with them to be able to get them connected to community-based programs and organizations, as well as consult with them to kind of alleviate those needs, right? And so if they, are out of work temporarily because they have just been shot and they're feeling the financial pressures, and those financial pressures are leading them circumstances that might get them re-injured, we sit there with crime victim compensation and help them with unemployment insurance benefits and, applying for jobs and whatever they need. And continue those over a sustained 6-month period. We are also then following them up over the course of a year to track to see if we are reducing re-injury, but we're also looking to see if this improves their well-being in other domains, if they are ending up with better mental health through receiving these services, a quicker recovery period, better employment outlooks, making more money, all right, having a better relationship and quality of life, which I think are other, tangible and key metrics of these programs and key goals. Final thing I'll note is we're part of a research-funded study, so we are comparing those services to a control group for the research evaluators out there. So people are randomized to receive those services versus the standard what the hospital is currently offering, kind of a lower degree of services. And that's going to allow us, when this study concludes in 3 years, with a larger sample of people to recruit it, to have the data to be out there to go and say, is that investment in those more intensive services worth it? And being able to put a metric behind it to say those more intensive services reduced violence by X%, they improved employment outcomes by X%, and as Lupe was mentioning, we can put a cost benefit on it to say, for this upstart cost that we have to invest in it, we can save, X amount of money, we can get big returns, and hopefully that helps people continue to invest in community violence programs like this.
Amazing. So I'm a little overwhelmed with all the cards in front of me right now from all the questions coming in, so forgive me here. But I'm going to start with, so thank you, audience, for all your great questions. I appreciate this. And I'm overwhelmed with the amazing expertise on this panel right now as well, because I love hearing the passion, but also the thoughtfulness that goes into these programs as well. And I hope that you guys are hearing just the intentionality that goes behind this, because you have to be intentional when you're thinking about addressing gun violence. And one of the questions that came through here was, what are some ways that we can unite educators, clinicians, and violence interrupters to target young children and teens in violence prevention? And then what are some barriers in uniting people? Because I think the theme, and I like this question because it unites some of the themes that are coming up here, is we're not all siloed, right? Nope, nobody can do this work alone. And you can see the theme that came out throughout everyone, and even as Dr. Henderson was talking, we have to kind of come together to address this problem. So how can we bring people together? to really look at young children and teens, and what's preventing us from being able to do that? I'm going to open it up to anyone on the panel, and y'all can chime in and share your opinions.
I think convenings like this work, right, where you get the right people in the room who not only understand the grassroots need, but also understand how the system is structured. And without those two entities at the table, you miss something, right? We need more policymakers willing to listen to people who have real experiences, right? Lived experiences applies more to people than just being a victim, right? It's also vicarious experiences that people have. We need to train people in communities who are vicariously victimized in these spaces. Many mothers don't know how to handle this. Many fathers don't know what to do. We're trying to shift an entire culture to understand that there's another way to handle conflict, but also deepen that's another way to handle poverty. And I think if we deal with those, I'll move into the conversation about the barriers. Those are the barriers, right? Is that we are politically correct in far too many instances. We have to be comfortable with tough conversations. But we also have to understand the role that political ideology plays in these spaces. And many people are trapped in environments where they can't freely express what we really need to do, right? And so I think we have to allow people to be comfortable in spaces that are uncomfortable and not face repercussions because they're honest about what'll save lives. I'll pause there.
Here.
I'll add, when I love the name of our division because it starts with community health and violence prevention. And so the first word is community. And when I came into the role, we were very strategic on community engagement. We did, of course, COVID was still in fact back then, so we were doing virtual meetings, and then they went into hybrid meetings. So our team, we do a lot of community engagement, and so we're fortunate that through relationships, you know, we've established those relationships, and Dr. Larry D. Brown Jr., who's my associate director, we talk about this almost on a daily basis, is the power of those relationships. We both come from a juvenile justice background. He has a racial equity background as well as a researcher. But we're intentional about who we connect with. You know, we go out and seek events to be a part of, and then we also host events. And the beauty of being a part of public health is that we can connect to the larger public health events. And so we've been able to connect not just with HISD, Worthing High School. The team is at Worthing High School almost on a daily basis because we were told by a commander with HPD, hey, they're averaging like 15 fights a day. And we know a lot of the things that start in the school will, you know, spill over into the streets. And so the team, you know, has been very effective there. In Cypress Station, we've connected with Spring ISD. And so we've had numerous events there where we attend and we connect with people. It's that organic connection and being intentional about maintaining those relationships. You know, if it's a good relationship, it's gotta be, you know, there's an exchange, you know, where there's no exchange, there's not really gonna be a relationship for a long time. But we also have a connection with the Harris County Juvenile Probation Department, you know, considering that's where I grew up. I started my career there. I won't tell you what year, but way back when. And so now we have those departments across the county and the city who are reaching out to us to say, hey, how can we work together? And the big group right now that we're trying to target are the youth. And then the youth that are in detention with those felony offenses, you know, what can we do to get them released? Because we know the longer they stay, the more likelihood is that they're gonna get sent off, either to county placement or to the state. But also the kids who are at home, you know, under supervision. We have a presentation coming up that we're doing for them, for the youth in the summer. We have a few presentations that we're working on where the team themselves, they will hear from the team. And we're gonna keep those relationships going. So we have a lot of things that is brewing on, what can we do, whether it's the adult system, the juvenile system, and then the prevention piece. So that's a big part of why we have the Rise Empowerment Center and why we're looking for the other location in Southeast Houston, is to bring community together. We don't pretend to know it all or have all the answers, but we know that, just like we say in church, everything you need is in the body. Well, everything that we need is in the community. And so we keep bringing all those stakeholders. Some of the barriers, I think people oftentimes wait for formal agreements or wait for, what's the funding or who's gonna have the money. We're all about, let's just do the work. Can we just keep getting it done? So we don't have age limits for that we work with. We work from the youngest to people in their 60s that come to the hospital. And then we don't ever have a time frame where we say, we have you on our caseload for 3 months or 6 months, and then we're gonna close you out or discharge you. We let go of them when they let go of us.
So kind of looking at, we've talked a little bit about resources here, and there's been some few questions asking specifically about how do you guys look at your resources and evaluate them as far as the best way to use them, especially when we think about, specifically to Dr. Berry, like getting resources into the right spaces, especially schools. Like, we need to target kids at that younger age. I think that magic question is how do we get to people before the violence starts? And I think people think a lot about getting to kids in schools because that's where kids are all the time, but there's a lot of things going on in schools. Where are the places that we can intervene for kids before that violent cycle starts? How do we find them? Where are the resources? Do we know about the resources?
Well, I don't know all of the resources.
I don't either.
But I think part of that is the collaboration.
Right.
And what he mentioned before is getting everyone that has a different perspective and comes from a different place together to kind of talk about those things. And back to what Lupi said, I didn't have a budget when we started. There was no budget. It was really, what do you need me to do? What do you need? And it was a true collaboration. And then just figuring on our part, figuring it out along the way. I think some of the barrier is still just a misconception whenever you talk about violence prevention. People get fearful. There are probably some schools where they might not want you in the school, but what you do is find the partnerships that are open. The Spring ISD, the schools in the neighborhood that are really facing this situation, they will be willing to partner with you and trying to be creative and find a way to work together, whether you have a formal contract or you have allocated funds for that specific program. A lot of everything that we do out of my center is really voluntary, even if it's other trauma surgeons or it's staff. And we're just blessed to have people that are passionate and interested in helping. I know that can't be global, but that's just personally the way that we've been doing it. We don't specifically have funds. I'm actually, since the election, I've been very concerned about the funds, not for our program. I think the people in Houston were very smart in the way that they structured their budget for that, but there are a lot of programs around the country that have been severely impacted by the cuts that were done at a federal level. The first Office of Violence Prevention at the White House was immediately dismantled after the election. So there, in terms of resources and funding, and I don't know, I would be interested in how that impacts you guys since you had an NIH grant, but I know that there is concern. The hobby, if you're familiar with that, they've done multiple town halls and meetings kind of discussing resources into the future, but I think it gets back at the grassroots, people that do have a passion. There are enough people with a passion out there to kind of be creative and do what's needed. I know that's not very concrete, but sometimes it's not difficult. You find a principal that's willing for you to come in there You teach them conflict resolution. You have your community violence interrupters go in, teach the kids how to, you know, deal with the fight, like you said, growing up without going to the car and getting a gun. I mean, it's very simplistic, but those are some of the things that I think we need that don't take a lot of money.
I would love to elaborate a little bit and give Dr. Testa a chance to talk a little bit about and this is actually another question too, talking about how do we address funding and sustainability, especially in the current climate as well.
Yeah, let me talk about that, because I think what's amazing about all this conversation is just how much is being done with so little support and resources. Like, it is just like grassroots efforts, very, very busy people volunteering, time because they realize it's an important issue. And, there's lots of statistics and about how much, compared to other causes of death and injury, how much less money is invested in gun violence compared to other things. And so it's frustrating often if we just had the resources, probably how much more we could accomplish with it. But there's just a tremendous effort with kind of so little. And I think there does need to be awareness that we're over the next several years, we're going to be operating in a different climate where the money is not going to be flowing in, the same way, and we're going to be operating with even kind of less resources than possible. And a lot of programs are going to be operating under uncertainty. So I think in that regard, I'm not sure anybody has a perfect answer for that at the moment. I think a lot of people are grappling, but some things that I do think are, three things I think are important I would think about are, one, people coming together and kind of collaborating, because I think that shared resources among people with a common goal can really help kind of stretch things. There are a lot of people in this community who have a shared goal of reducing gun violence and violence, and I think that this community does a great job of connecting those people, but we could probably all come together and be strategic to maximize our resources a little better. The second is, I think that we need to realize that some of the traditional areas of funding are probably not there to the same level, and so we might need to be strategic about looking at alternative funding sources and stuff. And it's definitely not an easy area to get people to invest in, and companies and philanthropies and stuff, but seeking out funds. Everybody lives in this community and everybody benefits from a safer community, including businesses. People do not go to businesses, and businesses do not move to this community if it is not safe. And so I think that if people come together, especially multiple groups and private businesses and philanthropies, here about how important it is to the community and what great work there is going, that's an opportunity to bring in some funding that's not reliant on federal dollars, as this often has. And the last thing I'll mention, again, to what we were talking about earlier, is really investing and showing the cost, the net benefit. There's a lot of talk also right now about efficiency and not wasting money. And so I think that we want these programs to be kind of long-term sustainable and those resources to be there. One of the metrics that we do need to think about and focus on is the net benefit in terms of cost savings, so that we can go and say that dollar that you're going to give is going to save money. It's going to return a benefit. It is a wise and smart investment to invest in community safety.
Excellent. And so then to follow up, Dr. Henderson, where would you put your investment in the future on this?
I was just sitting there thinking about how I could
I saw
convert
your brain
Starlink
moving.
into a violence interrupter, right? And my mind went somewhere else for a moment. But it was, these guys right here, they're doing the work at the level it needs to be done at, right? we have to be creative, right? We have to be able to make shifts. So in other words, instead of me talking about, gun violence in the black community, I also talk about suicide in the white community, right? And I include that in my sample, right? We have to learn, as many of us learned a long time ago, to code switch and be more encompassing in our work, right? Because the biggest problem is that we give this illusion that guns are only a problem in the black community. And I think the more honest we are about that, the more we open up this tent and we teach people about how guns are affecting everybody and the cost of those, economically, socially, culturally. I was watching a couple years ago a funeral on TV of a white kid who had been shot. And I said, wait a minute, I've never seen this on TV. Maybe not the time I watch TV. But then my heart went out to the mother, because the mother said, listen, I don't have I can't go to anyone for any social support because all the resources are designed in urban communities in place. And I said, you know what, we got a void, right? And so in rural communities, they have many of these problems that we don't even mention. To directly answer your question, we have to think about who all is really being impacted by this problem. And we have to have honest conversations about that, because democracy applies to research too, right? And being able to bring folk in who have a problem and don't have an answer, I think, is really the way forward.
Absolutely. All right. The way forward, that's where we're going to be continuing the rest of the day, is to be looking forward and being creative, being willing to pivot, to be encompassing, and know that gun violence impacts everybody, right? Couldn't said it better. So I know I'm standing between you guys and lunch. That's important. I do want to make sure we have a few announcements before lunch. So first of all, thank you to this incredible panel. They're amazing. Yeah, definitely. And I want to also make sure I take a moment to share with you in your brochures, we have some just general information about the Baker Institute. And also on the back page, there's the Baker Policy Analysis and Communications Seminar. It starts on August 26th. In the back is Dr. Chris Koleshka. He's waving, and you can't see him because he's in the corner, so step out, Dr. Koleshka. He is the lead policy leader for this course. So if you have questions about this is a 3-month seminar to really understand policy. So if this whole policy drive, and you're really getting excited about it and want to learn a little bit more and do more deep dives into understanding policy, he's the guy to chat with so that you can learn a little bit more. Otherwise, we will break and convene at 12:45, and we may end up, there's a lot more people here today than what we had registered, so we may end up doing lunch in shifts, so there may be an early eater and a later eater group, just to let you know. So I'm really excited to say that there are more people here than what we had anticipated, so thank you all for being here. Appreciate y'all. Good afternoon. Thank you, everyone. Good afternoon. I hope you have enjoyed your lunch. Please feel free to continue to enjoy your lunch. But what an amazing morning. We had such amazing content and incredible speakers, and I'm glad that we are continuing to connect and have great conversations, but I want to make sure that we move into our next panel. And to lead our next panel, I'm going to introduce Dr. Jeff Temple, who is a professor and associate dean for clinical research at the Betty and Rose Pfefferbahn Chair in the Child Mass Trauma and Resilience at the School of Behavioral Health Sciences at UT Health Houston. And with that, I'm going to let Jeff take it away. Thank you.
Thank you, Dr. McKay. Before we start, I want to say the most important thing is I couldn't find my orange tie this morning, but I did find this that kind of looks orange. If you squint, it's actually a shade of pink, but just pretend it's orange. Thank you all so much for being here. Thank you for having me, Dr. McKay, and everyone else involved. Thank you, Katerina, for organizing everything. I really appreciate it. And the two worst times to speak are right before lunch when everyone's hungry and right after lunch when everyone wants to go to sleep. So it's very cool that I'm in this spot. Thank you, Dr. McKay. All right, so we're going to talk about the intersection of intimate partner violence, domestic violence, and firearms. And I'm going to set the stage a little bit before I introduce our panelists. If you were to prevent family violence and domestic violence, you would cut firearm violence in half. Probably even more than that. If you take away gang violence and you look at just sort of that sort of everyday gun violence and mass shootings, you can track that back to family violence. In mass shootings, over 50%, 60% of the cases. With just sort of the everyday shootings, you can track a vast majority of them to domestic violence situations, family violence situations. So I mean that sincerely. We are in the social sciences. We're scared to say something causes something, but firearms cause homicides, and domestic violence causes firearm violence, and vice versa. So it really is that inextricably linked. If you look at, especially in Texas, where guns are popular, you'll see that when a wife dies in a domestic violence situation, I think it's something like, Dr. Wood and others might be able to correct me, but I think it's about 65% is when a firearm is used. So again, inextricably linked. If you look at mass shootings and you trace it back, and almost anyone that you throw at me, you're going to see a history of domestic violence or family violence. All right, so stage being set. I was told that when you introduce people, you're not supposed to say, like, this is Dr. Leela Wood, and then describe him. You're supposed to really set the stage. So how we're going to do this is a professor at UT Health Houston and the research director of the Violence and Injury Prevention Research Center, VIPER. That's the center that I direct, and Leela and I are going to get snake tattoos because of VIPER sometime. We haven't decided when, but we are going to do that. A mixed methods researcher, a social work practitioner, and studies looking at the understanding and prevention of multiple forms of violence across the lifespan. Please give it up for Dr. Leela Wood. Born in Houston to immigrant South Asian parents, studied at UT and U of H. Did I do that right? Yeah. All right. I'm a UTSA grad, so any other? There we go. Fear the Beak. Anyone watching college baseball saw that UTSA beat UT and advanced to the Super Regionals. They're playing tomorrow against UCLA. I expect you all to watch. She has worked in nonprofit arenas in India and Texas. She serves women and children, especially in underutilized communities, and she directs the AAPI Community Safety at DIA Houston. Please give me a round of applause for Swati Narayan. And lastly, I have known Dr. Mytelka, I messed up and didn't end with it, for many, many years. We both live in Galveston, and I've known her, I think, since probably high school, but then with college, graduate school, was a licensed social worker, worked with us in our center when I was at UTMB in Galveston, and now she is our postdoc at VIPER. I'm not sure, are you going to get a tattoo?
I wasn't invited yet, so.
I'm asking you now.
All right, let's go.
All right, she's in. Will this be your first?
It would be.
That's perfect. All right. So she is interested in positive youth development in schools, especially with underserved populations. Really interested, which I really like, is a strength-based focused on mental health promotion in preventing violence, dating violence, and other forms of violence. Dr. Caitlin Mytelka. All right. while I want to stand and be the most important person on the panel, I'm going to sit to lift y'all up, really.
Thank you. Thanks.
That's what I'm doing. All right, so I want to start just very generally. I set the scene. Tell me about the link between family violence and firearm violence. Leela, go ahead.
Okay, I think one thing that's important to understand about intimate partner violence and broader family violence and firearms is something that you touched on earlier, Jeff, which is that firearm violence and IPV are co-occurring so frequently that it's really hard to disentangle them. And one thing I think that we can do is talk a little bit about what that looks like. So when we're talking about IPV and firearms, one thing we're talking about is homicide, of course. We're talking about death related to firearms. And last year in Texas, 205 people were killed in this state because of intimate partner violence, and most of those were firearms-related fatalities. But there are a lot of other ways that firearms violence and the threat of firearms violence comes into intimate partner violence and family violence. And that is really through the use of the threat of a firearm or the threat of violence against a victim or against their children in the context of intimate partner violence. So I'll just give you an example. I'm a qualitative researcher. I interview a lot of domestic violence survivors. And recently a survivor told me that one of the things that her partner would do was get out his gun and clean it in front of her, just very suggestively, when he would be upset with her, right? All he would do, he wouldn't say a word. He would get the gun out of the safe that she did not know the combination to, and he would clean it in front of her as kind of an implicit threat. So even if the firearm isn't actively being used to harm somebody, which it often is, the presence of the firearm in the home is a way to control and monitor somebody's behavior, and not just the adult victim, but also the children. So I think one thing to understand about intimate partner violence and firearms is that just the sheer presence of that gun in the household can raise the stakes, not only for there to be an injury or a homicide, but can make it so that somebody has to act in such a way to avoid violence. Basically, it allows a partner using violence to control somebody to such a level that they're not able to have autonomy and independence.
Yeah, you know what's one of the, I started looking at this link in the 90s, and one of the surprising things was that even just the mere, this relates to what you said, even just the mere presence of a gun that's in the house, even if it's not brandished, if it's there, that's associated with increased violence, sort of what they think is a priming effect. So really interesting stuff.
Can I add
yeah, please.
one thing to that? So, so I work in a domestic violence, sexual assault organization, and I know that we're throwing out terms like domestic violence and intimate partner violence, and sometimes they're used interchangeably. But I want to make sure that we understand the difference between domestic violence and intimate partner violence. Because domestic violence occurs within the home, and it can be intimate partner violence. But then intimate partner violence can also be like between like a boyfriend and a girlfriend. So they don't necessarily live in the home, but that threat of a firearm still, could be present. So I just wanted to make sure that we understood that it's even more pervasive than we might think. And to your point about the threat, like cleaning the firearm in front of somebody, we've had instances where the abuser is literally raping his wife or girlfriend or whoever it may be, and the firearm is right there next to, either next to them on the bedside table or in the drawer, right? So the mere presence is enough to sort of forcibly act out whatever they want because, the victim is scared.
Yeah. We have laws related to domestic violence and family violence, firearms. And by the way, it also means former partners as well.
Yes.
So we have laws. Tell me why they work and why they don't work.
I can
Go for it.
start us off a little bit, and then just also jumping on to what we're talking about, this concept of coercive control with a firearm. So we know we have domestic violence protective orders, and also red flag laws in certain states for extreme situations. So we know in some cases that these can be effective. In some ways, in some states, possession of a firearm is illegal once someone is convicted of a domestic violence crime. However, also there's mandated relinquishment of firearms. This is something that we don't have a lot of tracking on, and something that we know is effective in states that have stronger controls around this and have ways in order to mandate that firearms are relinquished in situations. And so this is something that, and I think that my co-panelists can speak to this also, this can be something that is weaker in states where we have more lax gun laws and it's hard to track. So this is one way that we know they work, and at the same time they don't work in cases where we're on the honor system. And then also speaking around coercive control, thinking through how the laws don't necessarily include coercive control when a firearm is present. This is something that we know that we can use to strengthen laws, looking at patterns of control and manipulation and behavior with coercive control. Oftentimes this is something that kind of undermines a victim seeking help in some ways, because it might not be that there's a physical attack, but this presence of a gun sort of creates an ambiguous situation where it's hard to talk about, you know, do you report this person for abuse in that situation? And we know that when there's the presence of a gun, it's like 5 times greater risk for homicide for those that are survivors or victims of intimate partner violence. So super, super high rates. The risks of gun ownership in those situations are really, really scary. And so thinking how we can add coercive control into laws and regulations in states, so that these are patterns that we look at and that could also be flagged when we're looking to enact domestic violence protective orders, and looking at red flag emergency situations as well.
I think when Rahimi was overturned.
Well, I'm going to stop you there because I want you guys to define for me, just because we're intimately involved in this. Leela, if you could define coercive control, and then Swathi, if you could come back and describe what Rahimi was and is, and how that affects everything.
So when we think about intimate partner violence, we think about physical violence, threat, you know, injury or homicide from a firearm. We might think about sexual violence, like a rape, a sexual assault. We think about psychological and economic IPV, right? Mm-hmm. Taking somebody's money, making somebody do work, or putting somebody down, calling somebody name. One form of both psychological and physical and kind of all-encompassing form of intimate partner violence is something we like to call coercive control. And it is a level of surveillance, monitoring, threats that is psychological and physical in nature, and can involve sexual violence and economic violence too. It's monitoring where somebody is, monitoring where they can go, what they can do, isolating somebody. So it's a level of violence that kind of transcends across these types of intimate partner violence or dating violence. And it's really prevalent. So in some of our recent samples, up to 85% of survivors that we sampled had experienced coercive control using a behaviorally specific measure. So we don't say, have you experienced coercive control? Because we don't think about that differently, right? We have a list of items we use to kind of assess that. So it's a really common form of intimate partner violence, and especially for those working in community-based programs like DIA, it's something that we see a lot and is one of our main strategies to address when we're trying to prevent firearms violence.
Yeah, now I'm going to put you on the spot, Swathi. And in addition to talking about Rahimi, if you can talk about laws that predated Rahimi, what Rahimi meant, and where we are now.
Okay.
And the meaning of life.
You know, I don't really know. Well, I'll talk about Rahimi in a second. But I want to, so every time you say something, I'm like, oh, yes, and, because when you talk about coercive control and how you study it, so in a DV agency or a DV org, we are, when somebody calls us, so we have a helpline, and when somebody calls us, we go through, that helpline advocate will go through, sort of questions and work around safety planning, right? And so a lot of those questions are exactly what you were talking about, the emotional abuse. Are you being stalked? Are you being, can you talk freely? Can you email freely? And we keep track of all of that. And so for us and what we see, coercive control is 100% prevalent in all of our cases. And then when you add the presence of a firearm, just the mere presence, it just exacerbates the fear, exponentially. Okay, now to talk about Rahimi. So Rahimi was a person, a man who lived in Texas, and he had been accused of
A lot of
yes. I mean, there was a
yes.
lot. So his partner went and sought a protective order, and received one. And part of that protective order at the time was that he should relinquish his firearms, of which he had many. And he argued that this is his Second Amendment right to be able to protect himself and to be able to retain his firearms. It went to, I think it went to the 5th District, and then it went on to the Supreme Court. Once it went to the Supreme Court, this was 2 years ago now? Last year? 2 years ago. 2 years ago, the Supreme Court handed down a verdict saying that no, in fact, well, actually what they said was it's within the state's control, I think, right? So the states sort of have jurisdiction over it. And so here in Texas, we had laws that if you have a protective order and you do need to relinquish your firearms. However, the issue becomes the process to relinquish the firearm. So just because you have this law on the books, there is no comprehensive process, whether it's in counties, whether it's in cities, even statewide, there is no comprehensive process to relinquish firearms. Who is going to ask for it? In some instances, judges don't feel empowered to ask for those firearms to be relinquished. And even if they are, to whom? Is it going to a family member? Is it going to go to law enforcement? Who holds it in the interim? That part hasn't been figured out, and therefore, even though it's been overturned, it sort of still exists, and it's still a battle. And we see this time and time and time again.
Yeah, and I'll just add a little bit about that. So we know that, so typically there's legal protections to remove firearms if somebody has a protective order against them. If somebody has sought a protective order because of domestic violence and been granted that protective order. And the problem, of course, becomes with Texas doesn't have a robust network to actually take those firearms. Other states do, though, and we know that it can be really helpful in improving safety when those firearms are taken away. So it's a policy solution that has a lot of potential, it's just not consistently applied. Another innovation that I want to talk about that is actually really robust here in Harris County is something called a domestic violence high-risk team. And what a high-risk team does is it's an interdisciplinary group. It's law enforcement, it's prosecutors, it's domestic violence advocates, it's researchers, it's community violence interrupters. It's a whole group of people who get together for a big meeting every 2 weeks or so. And what they do is they go through the highest risk cases, and I'd be happy to share about how they decide if somebody's high risk. And what they do is they work on things like firearm surrender, monitoring. We know, another thing that we know is really helpful if somebody's been arrested for domestic violence in preventing subsequent violence like firearms is an ankle monitor, is monitoring somebody that with GPS monitoring. So a high-risk team gets all the players together and they talk about specific cases and they put things in place to try to prevent that person from harming somebody again. Because we know the most dangerous time for a victim is when they're trying to leave that relationship. So the high-risk team comes together to help try to protect that person. So that's one important policy innovation that could be helpful in these cases, especially when everybody in the community is willing to play ball together.
Yes, speaking of policy, there's another important point that should be addressed. There's a thing called the boyfriend loophole. So all of what we have been talking about is married couples, right? So if it's a boyfriend or girlfriend, our common law, yeah. So if it's boyfriend, girlfriend, that the law does not apply, that the abuser does not need to relinquish his weapons, and that becomes a problem for many reasons. One, because we're getting married at later dates, people are not getting married at all, so it's not hitting a lot of the folks that are in domestically violent relationships. Thankfully, we have the Safer Communities Act, which addressed the boyfriend loophole. Many states already did themselves, but Texas did not, and we had that. But then what happened was that was voted down by the Supreme Court, was overturned by the Supreme Court, and I think it's still pending now. Dr. Metelka, what do you think about all this?
I think that one policy advocacy point for all of us who are working in this is definitely to push for legislative reform, policy reform, particularly issues around gun relinquishment, closing the boyfriend loophole. One issue kind of near and dear, and from my area of research, is school-based prevention and prevention of teen dating violence. We also know, obviously, among teens, there's not typically cohabitating, not married, but we still see a lot of the co-occurrence of firearms violence and teen dating violence together. And so I think that closing the boyfriend loophole is really important for issues like that. We know that teens are accessing guns, whether they're 18 or not. And so I think that that is a really important piece of policy also. And then, yeah, I think that coming together in order to do, like, preventionists on both sides, really, rather than working in silos, which I know we're not, but also working more to cross-collaborate and cross-train, and just also think about education reforms. I'm really interested in school-based policy, teaching healthy relationships in schools, using school-based models around social emotional learning, thinking about universal prevention and how those things can also touch on decreasing teen dating violence as well as firearms violence in schools. And I think there's also a lot of policy avenues for that as well that we need to continue to advocate for and explore how they work and evaluate them. So some little additions there.
Yeah, no, perfect. And Swati, I'm going to come back to you, and I know you're instrumental in sort of cultural adaptations and how to apply these policies to specific groups, in your case, South Asian immigrants, AAPI community. If you could talk about just the issue of IPV and firearm violence from that lens.
Yeah, so, you know, this whole conversation that we're having, you know, when we talk about collaboration, we talk about working with other entities, is wonderful, but we also need to be mindful of the fact that people who are affected by violence period, but then also domestic violence and firearm violence, speak different languages, right? They come from different cultural perspectives. And so DEA is almost a 30-year-old organization, and DEA is a Sanskrit word. It means compassion, and so that's the core of how we operate. And so we serve everybody and anybody who is a survivor or who calls us and is a survivor of domestic violence or sexual assault. our niche, our expertise is the fact that we are sort of rooted in cultural competency around South Asian culture, South Asian languages. So all of the support that we provide, whether it's mental health, legal services, financial, well, everything that we do, our case management, we do them in almost 18 different languages. And then, so when you talk about like firearms and firearm relinquishment or fire laws, and those also have to be translated into languages so that communities can understand what their rights are, their basic rights are, right? Just for safety purposes. And so that's a big piece when you're talking about communities whose dominant language is not English, so not just South Asian communities. And then you had asked me a question about,
The meaning of life.
No, there was something else. And so anyway, so that is, and so when you were talking about healthy relationships, right? So we do a lot of training on healthy relationships, because what we have found in our communities is when, we sort of talk about domestic violence, people will say, oh, no, that doesn't happen in our home, or that doesn't occur, that's, or sometimes some of these communities are rooted in patriarchy or the way things have been done for generations, right? But just because they've been done that way doesn't necessarily mean it's right? And so rather than approaching it from, that's domestic violence or that's harm, or that we sort of turn it over and talk about what a healthy relationship should look like, so that maybe it turns on something in our community or to the people we're presenting the workshop to. And then we often find that people will call us and say, okay, I heard that this is what it's supposed to look like, that's not happening for me. And it sort of paves the way for conversations, and then, better safety planning, right? But the agency always stays with the person who is reaching out to us. We never tell, him or her what to do. We sort of help them through that process.
Yeah, two things there. One, 18 different languages is insane. That's amazing. You guys are doing amazing work.
Well, and Dr. Testa was talking about in the previous panel about, community-based organizations are doing so much more with so much less. I mean, that's exactly the case for us. Funding is being cut for gun violence prevention efforts, but also for domestic violence.
Right.
So now here we are, we're working at the intersection of both, and we have far less resources to do that with.
And no fluoride. I think that's the safest thing I could say without someone. Yeah. Anyway, we're not getting funding, and we're getting bad teeth. Wait. I was going to ask. No, you go.
Go ahead. No.
This is terrible. This is not working out. Dr. Wood, I was going to say something else. After the languages, I was going to say the other really smart thing that all three of y'all are doing is focusing on the positive and the healthy relationship. So it's not just about, preventing violence, but it's about how to actually be healthy and happy. And I think that's especially important with what you do in positive youth development. And, 70% of kids will not be in a violent relationship, will not be in an abusive relationship, but we still want them to be in a healthy and happy relationship, right? Dr. Wood, did you have something?
I do, yeah. I think one thing that when we're talking about DIA or any of these organizations, and it actually relates to what you just said, Jeff, is that community intimate partner violence programs are really essential to ending firearms violence, and it's happening in a couple of different ways. One way is through our hotlines and our shelter and our housing programs and kind of the immediately getting victims and their kids safe. But another way is through this healthy relationships education and through things that address multi-generational stressors, right? Most of these programs are serving people who have children. And those kids, we know from your research, Jeff, right? Those kids are at risk for not only experiencing, if you grow up in a house where there's domestic violence, you're at risk for not only being a victim, but also being a perpetrator, or maybe both, right? So working with victims and their children is one of the most important thing we can do to stop these multi-generational cycles of violence. So when our community organizations work on these healthy relationship programs with their clients, it has multi-generational benefit, and it helps the whole community become safer. So what excites me is when we have our community domestic violence programs like DIA or Houston Area Women's Center working with the community violence interrupter programs, because we're seeing some of the same families over and over again. And this is all happening in some of the same communities. Communities with high rates of gun violence also have high rates of IPV, right? We all need to be working together on this. But these community intimate partner violence programs offer so many services. I don't think people realize how many services they offer. They offer hotline, they offer housing, they do prevention work, they help with economic justice work, get people to work. There's just so much happening at these community organizations, and all of that helps prevent firearms violence, not only from the adult victim, but for the kids that they have. So investing in your local programs, especially right now when funding is so scarce, helping out your local intimate partner violence programs is a great way to address firearms violence.
Yeah, I mean, like, for example, if somebody calls us and they're in an abusive relationship and they need safety, you know, they have decided they're going to leave their abuser and take their children with them. So, you know, we sort of talk out what that safety plan looks like. We don't have a housing facility, but what we do is provide rental assistance. And one of the reasons we provide rental assistance is that if you have children and they are zoned to a particular school, but, you know, and if you had housing and the housing is, you know, far away from where that zoned school is, you're creating another barrier, right? So we provide rental assistance nearby, you know, the community where they are, so that there are fewer interruptions to the children's routine as possible, or even work. I mean, sometimes some of our clients don't have cars, right? So being able to be nearby work, or if they don't work, or if their status is tied into their abuser. We also provide, you know, legal services for that. We provide mental health services, again, and you know, to be able to move beyond, you know, a domestic violence situation is quite a bit of therapy, you know? I mean, you have to have like a stakeholder, and so we provide that. We provide grocery store food, grocery store gift cards. We provide transportation. All these basic necessities, which sometimes we take for granted on a daily basis. When you're fleeing an abusive situation, and sometimes the only thing you're able to take, you know, is a suitcase and maybe the clothes off on your back, that's it. I mean, you are starting from scratch all over again. And then if you add in the extra layer of not speaking the language, not being from here, and then not even having a network of friends or family to rely on, it makes it that much more arduous and difficult.
Well, I think one of the things Dr. Wood and I talk about a lot is, and Dr., if you haven't figured it out, Leela and I work very closely together. That's why we can be mean to each other. Is that, you know, child care is violence prevention and gun violence prevention. Livable wages is violence prevention. Affordable housing is violence prevention. And the services that y'all offer at DEA are violence prevention, including translation services. That itself is violence prevention.
Language justice.
Yeah, at language justice, absolutely. So someone commented, less of a question and more of a statement, that the first four letters of the Second Amendment is a well-regulated militia. And I think that's really important when you consider our U.S. military. You will be court-martialed for domestic violence. You'll be kicked out of the most well-regulated militia in the world. So, you know, you kind of lose your Second Amendment rights. in that case. Another question, this goes to anyone who wants to address it. You know, if you open the newspaper on any given day, I guess no one opens it anymore, do they? If you open your phone on any given day, you're going to see a story about murder-suicide. It happened in Galveston, where I live, last week. Can y'all talk about that, how it relates to domestic violence, and certainly we know firearm violence is sort of a given, but how it relates to domestic violence?
I mean, I can give you examples of a few. Last summer, November of 2023, there was a young Indo-Caribbean woman who was seeking a protective order for a very long time from her partner who had been abusing her. And she sought a protective order once, was denied, finally got it. Actually, now I'm trying to, maybe she didn't get the protective order, or she got it the second time, but then decided to file for a divorce after she got that protective order. As you were mentioning, that time when a survivor leaves an abusive relationship is the most dangerous time for that particular person. So look at what's having to go through, especially if there's a firearm involved, right? And so look at the calculations that a person needs to make to flee an abusive situation, especially if there's a firearm involved, and the courage that it takes to stay or the courage that it takes to leave. And so she left, she filed for divorce. Her estranged husband came to the house. He shot her in front of the kids. Well, first strangled her sister, shot her, and then, died by a self-inflicted gunshot wound. So it absolutely wreaks havoc on families, and especially, if children survive, or other, family members who survive. And, again, the presence of a firearm is detrimental in so many different ways, not just to the person the violence is being perpetrated against, but many times the perpetrator, him or herself.
Thank you so much. And I was going to move on to the next question unless you all have something to add to that. All right. So this is a really great question, and I wish I was on the panel so I could address it. But I am going to channel the two people I work very closely with, Dr. Meitelka and Dr. Wood, and hope that they answer in the way that I would, but more articulately, of course. So we've talked a lot about these services for survivors, this whole time we've been talking about it. And we always seem to put the onus on survivors, and mostly women. What is being done to prevent perpetration and maybe re-perpetration? Let's target those folks.
Well, when you asked about the murder-suicide, I was thinking about this. So when folks are younger in the lifespan, in adolescence, and I'll let Caitlin talk about this a little bit more, but we have some really high-impact prevention and intervention strategies. But what a murder-suicide brings to mind is one of the things we haven't done as well with is figuring out what to do with adults who are using violence and harm in a relationship. Several of the strategies that we use are called batterers intervention and prevention programs, or BIPs. They have varying degrees of effectiveness, and it's also something that isn't studied a lot, right? A lot of folks who do the work that I do aren't focused on people using violence and harm. So by varying effectiveness of batterers intervention programs, I mean, it doesn't look great when you look at the data on a whole. Some programs are more effective than others. In recent years, we've also used restorative justice and community accountability to a little bit, there's some promise there. That takes a lot of intensive training and strategy, but there are some communities that are really using restorative justice work especially when it's a small community. I'm from right next to a very rural part of Indiana, and there are some communities where a small cultural community or rural community where restorative justice works really well, because you're not going to be able to avoid each other in that town, right? So batterer's intervention, restorative justice are some of the strategies that we use, but one of the things that we have to work on is what to do with adults who are using violence and harm in a relationship. So it's something I think is going to take researchers like us, but I think it's going to take community practitioners who work with these populations and have strategies. It's a place where we need a lot of innovation. I will say, though, if you've got a teenager, if you've got young folks, we know a lot about what to do to prevent them from not only using violence in the first place, but from using violence again. So, Caitlin, you want to say any more?
Well, I do want to add a little more about school-based prevention, thinking through like what we can do in the classroom and just school-based models on a tiered level, looking at universal preventive interventions, as well as for those youth that we know might be at risk or are already experiencing or perpetrating violence, and what we can do in terms of restorative justice practices in schools, how we can incorporate and of course, I'll give a plug for the 4th R, healthy relationships curriculums for those at the universal level. I know someone was speaking earlier about starting earlier. I think we can't really reiterate that enough, that high school is really, really important. Young people do see additional stressors and risks associated with dating and with puberty as we move through high school, but it is really, really key to start sooner than that. I think in middle schools, especially, even, in elementary school, teaching young people relationship skills, thinking through like the kind of model around social emotional learning, skills around self-awareness, skills around relationships, thinking through self-management skills, and teaching these to young people. These are skills that can be learned and implemented over time to help reduce incidents of violence as young people get older. And then also specifically having groups with young people that might be at risk or displaying signs for violence in schools, I think is really important. Some of the research that Dr. Temple, Dr. Wood, and others on our team have been doing for a long time is on a particular healthy relationships curriculum called the 4th R. It's reading, writing, arithmetic, but the 4th R is relationships. These are skills that are just really important that we could have, I think all of us, including myself, could have benefited from in schools, learning how to have not just a dating relationship, but friendships. How do we end a friendship? How do we end a relationship? These are skills that can be taught and learned over time to help us, I also think, address both, address those who might go on to perpetrate violence in relationships. And then just in general, speaking around positive youth development, I mean, these are just skills that are lifelong skills for us to have and know and use in all of our day-to-day interactions with each other.
So proud.
I do want to say, when you work with young people, I think it's really important to have the attitude of, you might make a mistake, but it doesn't define you.
Yeah.
So what's great about 4th R and other programs is it can interrupt a trajectory. Most young people, when they use violence, with some notable exceptions, they start out with lower levels of violence, and there is an interruption possibility. And so one thing that's great about the social emotional learning approach of something like 4th R is it also teaches people it's okay to make a mistake, and it's okay to be accountable for your behavior, and it's okay to forgive yourself. And so I think those are really tender, important lessons that programs like that, and one of the reasons that 4th R is so effective is because it uses that social emotional approach. It's one of several programs that has a nice evidence base, but there are strategies, and anybody at our center would be thrilled to talk about this if you want to implement youth-related programming or you want to partner on something. But there are strategies for working with young people that are really holistic and can easily fit with any kind of health development. So I think it's a really promising area, and one thing that we've been looking at is how these kinds of programs also might help prevent firearms violence. Do you want to say anything about that?
The only thing I want to add is how insane it is that we don't teach kids how to be in a relationship, right? Imagine if we taught, writing or English the way we teach kids a relationship. Be like, here's a pen and paper when they're 4 and say, write an essay, right? No, we give them the vocabulary, the mental acuity, the physical acuity, and we teach them how to do it, and we don't do that with relationships. So the fact that most kids do okay is actually kind of surprising.
Well, and the dissonance, I think, sometimes comes when, you have a curriculum and you're sort of talking about healthy relationships and, but then the child goes home and sees something very different, right?
That's a great point.
And then, so then there's this inner battle within the child, like, okay, what's accurate, what isn't, and so, and then, again, I'm gonna, do the language justice piece here, then you have, you have, add the other layer or nuance of speaking a different language, or, and culture, right? Because some things that you may talk about, how to end a relationship or how to, some of those may not be apropos in a different culture.
Yeah.
Right? And so, it's not as black and white necessarily, but there are basics that, we can take from those and then, and sort of try to implement them in a healthy way within the context of where that child or community is, right?
Well, that's a good segue for this next question that's for you, Swati, is you're going to nail this. And it's also a question that I'm surprised I didn't think of because came out wrong because I'm so brilliant. I don't know. I'm not, obviously, but it was just a weird thing to say. All right, so given the sensitive nature of a lot of the work you do and the folks that need your services are probably anxious to find out about them or to report or to, how do you get the word out about the fact that you even exist to these folks?
Well, so as I was mentioning, our expertise is around the South Asian community. And so we are very present, whether within the South Asian community. And South Asia, mind you, is not just India, right? It's India, Pakistan, Sri Lanka, Bangladesh, Iraq, Afghanistan. It is, and we're seeing a lot of people from the Middle East. And as we see our partners in this space lose funding, we are, receiving more and more calls. And so, what did you say? The question was,
how do they find out
about us? Yes. So we do a lot of in-person outreach. We're in temples and gurudwaras, in mosques. Working with the faith-based community is very important because, again, that's where a lot of families go to sort of seek advice, community. So we work with people who are 18 and older. So we don't work with children because to work with children, you have to do it right, you have to do it well, and it takes a lot of money. And so we don't work, we would love to be able to, so we do work with people 18 and older, and so we do outreach programs in high schools and college campuses. We are partners with HCDVCC, Harris County Domestic Violence Coordinating Council, TCFE, Texas Council on Family Violence. We work with healthcare, workers. I mean, people, we've been around for 30 years. So people do know about us. We work with Houston Area Women's Center as well. We are all, as they were talking about in the previous panel, we don't work in silos. This work cannot happen in silos. Sometimes a client will come to us and We know that there's another organization that has more expertise in that area, so we will do a warm handoff to another organization and sort of follow and make sure that that person gets whatever they need. And we've built relationships like that so that.
I want to say that I love the fact that, you know, the left hand is talking to the right hand. I
Yeah,
think
and-
too often in communities, there's these natural or forced silos. So we're out of time, but I want to end with one question, just a brief answer. That's a two-part question, actually. First, give us some hope. What are you hopeful about in the space, the firearm violence / intimate partner violence space? And the second question is, do you think I'm a great moderator or the greatest moderator?
I mean, the word goat gets thrown out a lot.
Yeah, no, thank you. Yeah, yeah.
But, I mean, you're
Yeah.
nailing it, boss. You got it. What gives me hope is the multi-generational work that's being done. Not only the work in schools, with youth, but the work that's being done with parents. Parents give me hope. We kind of left parents out of the violence prevention IPV game for a long time, and now we are partnering with families in a different way, and parents are a highly motivated group. So the multi-generational approach to working with families who've experienced intimate partner violence gives me a lot of hope. And DIA gives me a lot of hope. I'm a researcher, so true confession, DIA is often a research site for the work that I do. And the service model that they provide is so grounded in the community. And it's really, like someone said on the other panel, you know, we're with our clients until they're done with us. Well, DIA's like that too.
Yeah.
So it's really a best practice model. So this kind of organization gives me a lot of hope.
Now, how am I supposed to follow that?
Yeah, I feel like you gave Dia more attention than me.
You said we'd get those tattoos and we haven't done it yet.
That's fair.
Okay.
All right,
And he's
Swati.
paying for them, right?
Oh, new layer. Yeah, now he is.
Give us hope, Swati.
You know, it gives me hope that, you know, that we're seen, right? That people, you know, organizations see us. And also, you know, when I look at, you know, in a culturally resonant lens, when I look at our communities and more people come to us and say, this doesn't feel right. I know it happened with my parents and my grandparents, but this doesn't feel right. What do I do? And when you can build those trusted relationships with people and help them, you know, find sort of that healthy avenue in a relationship is powerful, because that's really what's going to interrupt that cycle, right? That's what's going to break that cycle. And then the language justice piece is also, I mean, there's so much that's important, but just recognizing that to be able to offer services in different languages, and other organizations beginning to recognize that if we're going to be of service to the community, we have to be part of the community. We need to speak the way the community speaks. We need to be able, and I see more and more of that, and so that gives me hope.
Well, both of you are terrible at brief. Dr. Meitelka, give us some hope.
Okay, brief hope. I think one of the things that gives me hope is all of the engaged people here in the room who are taking a Friday out of their time to learn with us and chat with us about these topics. I think that those of you that are engaged in intimate partner violence prevention, firearms violence prevention, just seeing and knowing how many people are joining us online as well, that gives me hope. Watching the landscape of policy change over the last 30 years gives me hope. I know that there's some room for doubts and sadness right now, but I...
What do you mean?
Yeah, okay. This is brief.
That's another panel.
But I seeing things, how they have moved forward, that gives me hope. And working with the youth of our community gives me hope, and to hear their answers, their thoughts around relationships, coming from a wide variety of cultures and backgrounds, and just seeing the importance of, like, just to piggyback on what you're saying, like, I don't want this for me. How do I make this different? How do I have a healthy relationship? And just having that concern for their own mental welfare and mental well-being as well. And then I would say greatest of all time.
Oh, okay, thank you. It's about me. So I was going to say, if you failed at the brief. Thank you. Please give it up for them, especially for putting up with me. We are to be back at 1:55, so it's plenty of time to get in line to take pictures with me.
Hello, everyone. Hello. Hi, we're going to go ahead and get started with our next panel. I'm very excited that we're going to be introducing our next panel with our future leaders, and they're going to be discussing their role in firearm injury prevention. This panel is going to be moderated by Dr. Zoaib Hafiz. He is a non-resident fellow here at the Baker Institute and an associate professor at the University of Texas Health Science Center in Houston. So please help me welcome Dr. Hafiz.
Hey everybody, it's nice to see y'all's faces and get a chance to talk to y'all today. So as Dr. McKay mentioned, this is the youth panel, which I think is hopefully going to be, I think it will be a very easily an exciting panel to get a chance to listen to. One of the things that for me, I'll just speak about myself personally, like sometimes when I watch the news, literally anything, the news, open my phone even to check my email, as you guys have probably know, you guys get inundated with firearm violence in Houston, Texas, America, and after a while it can start to just weigh on your soul, and maybe occasionally you get to a little bit of a feeling of hopelessness. And I wanted to maybe counteract that a little bit to show you guys, to talk a little bit about in the background that not on the news, maybe not even visible to us right now, is there's a whole cohort of young people that are quietly building a case. They're building careers, they're building ideas, they're building movements. They're motivated, they're persistent. I think one of the most important things is they're gritty, they're tough, they don't give up easily, and they're bright. So luckily we have 4 of them right here who are willing to stop their great work just for a minute and tell us a little bit about some of the cool stuff they're doing, talk about how they got into it, and just my hope is, I know that everyone here is doing powerful work, working really hard, and maybe starting to wonder, depending on where you are in your career, who's going to pick up the torch. And I just wanted to assure y'all that there's plenty of people that are waiting in the wings and really excited to keep the party going. So I'll introduce more or less in order, I think. Right next to me is Asa Singleton. Asa Singleton is a youth mentor for the Forgotten Third. He's an author, an entrepreneur, and a mentor who has a long history of advocating for youth, previously through my Brother's Keeper and Houston Health, and now volunteering with the Forgotten Third as a mentor. He'll be releasing a book called Credible Messenger, a My Brother's Keeper story with Carlton Harris. Has a number of businesses, including an all-natural juice business called Press Me Baby, a great name, and is a percussionist. He grew up in Houston, where, as part of his story, he was exposed to firearm violence and has had a number of ups and downs that allowed him to see the importance of firearm injury prevention from a variety of perspectives. Next to him is Dr. Ritika Pradutor, who is a recent medical school graduate from Long School of Medicine in San Antonio. She's committed to firearm injury prevention and education and research. She developed and implemented a curriculum for medical students and residents focused on provider-led conversations regarding firearm safety and secure storage, and has presented that work at the Bexar County Medical Society Public Health Committee and at the Pediatric Trauma Society National Meeting. She's an advocate for firearm prevention medical education and is a lifelong Texan. I think all of y'all are lifelong Texans, more or less. And she's from Dallas, attended Rice University, which is, it's a school here in Houston, where she studied bioengineering and civic leadership. She will be beginning pediatrics residency this summer at University of Washington, Seattle Children's. She made a great choice in going into peds, I have to say, where she will continue firearm injury prevention research and advocacy. In the future, she hopes to be a critical care physician, which we definitely need more of. Next is Millen George. Millen is a recent graduate of Rice University with a BA in social policy analysis and earned distinction in research and creative works. Throughout his time at Rice, he has conducted research on implementation to increase the uptake of evidence-based practices and worked closely with MD Anderson's Health Service Research Department. Importantly, for his senior capstone project, he collaborated with Brady United Against Gun Violence to design and administer a national survey of healthcare providers, evaluating a resource guide to facilitate clinician-patient firearm safety conversations. The capstone findings provide evidence of current sentiments around firearm discussions in healthcare and identify strategies to overcome barriers to these conversations. His work has been presented at various events, including the Rice Undergraduate Research Symposium, the ASCO Quality of Care Symposium, and MD Anderson's Cancer Prevention and Controlled Grand Rounds. And lastly, we have Sami Beg. Sami is a student and youth advocate for Houston, Texas, dedicated to advancing public policy around school safety and gun violence prevention. Sami, you're specifically, Spring, right, you told me? Or Cypress?
Yeah, Spring.
Spring, yes, from Spring, Texas, and represents the safety interests of over 850,000 students as the chair of the Harris County Safe Schools Commission. In that group, he crafts data-driven policy recommendations on firearm storage, mental health, and education access. Having served as a national spokesperson for March for Our Lives, he has spoken at both state and national forums to advocate for gun violence prevention. A Giffords Courage Fellow and published policy contributor, Sami is currently pursuing a bachelor's degree in social policy analysis and political science at Rice. So please join me in welcoming our esteemed panelists. So, very briefly, I think one of the things that is most interesting to me watching young people get into the space is why. What got you into it? I'll start with, who should I start with? I'll start with Sami, since I'm looking right at you. I'll go ahead. What got you into this space? Why firearm injury prevention?
So I started in gun violence prevention advocacy in around my sophomore year. I wanted to get involved in my community, especially post-COVID, and I found this organization because I was working in with like a school club in high school called JSA. It was like a political club, and our club president introduced me to March for Our Lives Houston, which is a local nonprofit focused on gun violence prevention, especially from a youth group, and I joined there. But my first exposure to gun violence actually came before that in 2018, around January, when my neighbors, Mr. and Mrs. Lamb, were murdered. They were shot and killed during a robbery, and that and like seeing the fear in my community was unforgettable. So that is really how I sort of started out in this space, and ever since I've been really passionate about bringing youth voices to the table when it comes to gun violence.
Yeah, well stated. How about you, Millen?
I think my time in the firearm safety and gun violence prevention space is a little limited compared to like my amazing panelists. I actually only got involved last fall around August. Some of you may have heard of this on the news, but on the first day of college last August, there was a shooting at Rice. One of my peers was shot and killed during a murder-suicide here on campus. And I think, like many, I was shocked, and I started thinking about firearm safety violence. Before, it was not really part of like what I wanted to do. A lot of the work I did was on cancer prevention, but I started to think maybe there's some voices needed in this firearm safety field. So my senior year, when I was deciding what to do for my capstone project, a project with Brady United against gun violence really resonated with me because it was a chance for me to, like Sami said, provide a youth perspective, but also it aligned with my goals as being a researcher. And so that's kind of how I started.
Thank you. And Ritika, I know you started within the medical school sort of world. How did you get into that space?
Yeah, so when I joined medical school, I wanted to do something related to surgery and then also pediatrics, because those were the things I was really interested in at the time. And so I was connected with the Department of Trauma Surgery at the medical school in San Antonio. And there was this idea floating around of creating some sort of firearm injury prevention curriculum because there's no standardized education on firearm injury prevention at the level of medical students or for residents. And some institutions have kind of their own curriculum they've created, but at that time we did not. So I was thinking about what sort of research I wanted to do, and this just seemed like the most urgent and relevant issue. And I knew it would also combine these academic interests I have while also was about public health and this issue of firearm violence, which I've graduated high school in 2017, and I have a younger sister who's 7 years younger than me, and even just seeing the differences in kind of my school experience and hers, as we're seeing more and more firearm injury and firearm violence, kind of the fear and anxiety around that, especially for our youth.
Yeah, well stated. And Asa, I know we've talked in the past about sort of your origin story and how you got to this stage. I know a lot of it comes from your passion for being a mentor and a mentee, but tell us a little bit about your background and how you found yourself being a mentor trying to reduce firearm violence in our community.
Oh wow. Okay, so we kind of briefly spoke about how I got introduced to really the political realm in general. Maybe about 14 years old, 15 years old, I got into a regular school fight. At the time, it was Young Men's College Preparatory Academy. Now it's called Mickey Leland. I had gotten a regular school fight, ended up putting a kid in a mini coma, and I ended up having to do a deferred adjudication. I went through the My Brother's Keeper program. I actually had an opportunity to work for that program. And I've been in the political realm now for going on a collective of maybe 9 to 10 years. When it comes to firearm prevention for me, I just feel that I was kind of doing the work a little prematurely. I feel like me and Mr. Harris were already doing youth violence prevention as a milestone for My Brother's Keeper. And so firearms was already incorporated and included in that. And then, later down the line, I would say maybe 4 or 5 years later, youth violence prevention and gun safety had become its own, entity. And so I would say when it comes to youth violence prevention and gun safety, I've been strictly focused on that for maybe the last 2 years. But as far as youth mentorship and, always being there for youth, I didn't grow up with a father. I didn't grow up with a mother. I had 4 women that loved me and they made it happen. So I try to be that big brother or that father figure. I have 2 sons as well. So wherever that needs be as a young adult at 25 years old and also having a little bit of success for my age, I just try to use that and cultivate our young youth. And yeah, I'm consistently doing it and keeping it going.
I think a little bit of success is a slight understatement, but I agree with you. Just out of curiosity, I'm going to give you a question off the cuff because we didn't talk, but I'm very curious, I know you've been in the mentorship space and you're saying more recently you've gotten into the firearm prevention space. How do those two intersect for you? How are they distinct? How are they different? How do you think about that when you're talking about, I would say specifically young men in our community and the people that you're mentoring?
Okay.
Does that make sense?
That's a great question.
Okay, good.
Okay.
That was a great question.
Okay. I think that they're very different because the risk factors that we don't put protective factors in front of dealing with youth violence prevention lead to gun issues. So I feel like gun safety is more on the post end, youth violence prevention is more on the pre-end. So I feel like depending on the curriculum or process that your program or your organization is using, you're either ahead of the situation, in the middle of the situation, dealing with it, or you're at the end of it. And I feel like a lot of times when we do speak on gun safety, we only implement that because of a situation that has happened. We don't really do a lot of prevention when it comes to gun safety. And so that's why, recently, over the last 2 years, Mr. Harris and I have kind of been trying to get in front of that gun instead of standing behind it. And so that's kind of how I differentiate the two.
And that actually, I think Millen can probably speak a little bit to this, because I know that you're trying to change the dialogue, especially within your population when it comes to changing the conversation through a social, just in your field, changing the conversation about what is good information versus bad information, and just expanding the dialogue in fire injury prevention. So could you speak a little bit more about, could you tell us what a capstone project is, first of all, and speak a little bit more about to what your project actually is about?
Yeah, sure. So as a senior in the social policy program, you're tasked with working with a community partner organization where you do a capstone project. A lot of these projects are focused on helping the community either get information that they need, whether it's is a certain program working, where are the gaps in the work we are doing, and how can we move forward so that we're helping our community the best way we can. Brady United Against Gun Violence is really interested in involving healthcare workers in this conversation of firearm violence prevention. There's this idea that obviously, as we all know, gun violence is very prevalent, but healthcare workers are often at the forefront. They see these people during clinic visits in the ER, and so they have a lot of potential to help prevent some of this firearm violence by including it as part of a regular checkup. It's really relevant in pediatrics. There's room for it in surgical areas, in emergency medicine fields. But the problem is, and like Ritika mentioned, not all doctors are comfortable doing it. And there's a need to see whether, first of all, is it necessary? Like, do doctors want this? Do nurses want this? Do EMTs want this? And then also, does a resource guide help them have these conversations?
What did you find in terms of whether or not these providers wanted it? Do they want it?
So going in, I was kind of misinformed. I kind of had this perception that physicians, nurses, EMTs, they don't have time for this in their field. But what we've actually found was close to 100% of providers that answered our survey actually found that this is really relevant. They found that it's important and it needs to be done. But the findings are kind of paradoxical, because while 7 out of 10 providers said that they're comfortable having it, over 50% haven't had these conversations in the last 6 months. So there can be several factors to this. Our takeaway is that there needs to be more training, especially based on the barriers that providers have given, such as having not enough resources, and also not being able to tackle difficult conversations.
What a perfect segue. And to solve the problem, Ritika is here, because you've built curriculums for providers and future providers in terms of how to have these conversations in an effective way. And so could you tell us a little bit about what it is you guys did in San Antonio? Because it's very exciting work, and then I'll have a follow-up question for you. But,
okay,
yeah.
Of course. So we initially wanted to create some sort of interactive curriculum for medical students and residents, because we found that a lot of existing materials about firearm injury prevention are either more community-facing and not necessarily for healthcare providers, or they're in the format of online training modules and don't have necessarily like an interactive component or even like a patient simulation or a case that's involved. So we created a curriculum using resources from different organizations. So Be Smart, the American Academy of Pediatrics Gun Safety Campaign Toolkit, and also Bullet Points, which is an organization that specifically makes like clinical tools. So their framework is largely what we use when we're talking about how like healthcare providers might want to think about starting these conversations, assessing like the level of risk for a patient and their specific situation, and then recommending an intervention that appropriately fits that level of risk. And I remember even like when I started medical school, learning to ask questions to patients, right, when you're taking their history, and one of the questions was asking if they own a firearm or if there's a firearm in the home, but there was no other guidance on like what do you do if they say yes, like what storage devices can you talk them through, what are different options that they have. So we also wanted the audience of our curriculum to know of local resources, so they could provide a map of where you can get free gun locks in San Antonio, which is made by Gun Safety for Bayard. And so even better if they're able to have gun locks like in their clinic or in their hospital, being able to provide that to a patient. And hopefully they are trained on how to use it, which is also something we are hoping to do so that they can show their patients how to use it. So that's kind of the extent of our curriculum. And we've done this with medical students and then surgery residents, pediatrics residents, and then are expanding to other specialties as well.
That's so cool. Isn't it kind of, so Millen did the research, Rithika took the research and applied it. I didn't connect this until right now. It's so cool. And then this leads us, it's so perfect. It leads us to Sami, who does a lot of work. I think you did work with March for Our Lives and manage their social media. So it's one thing to do the research, it's another thing to get our providers on board and get them the resources they need. But then how do you communicate, what the information that you need to communicate out to the general public or whatever your audience is? And I was just curious, what is effective in your experience? What was not effective, especially in terms of getting people to show up, I guess in your case, to live events? What worked for y'all?
We implemented the curriculum.
Sorry, go ahead.
Oh,
I was just about to ask Sami for March. Yeah.
Sorry.
But
Okay.
Rithika, I do want to know your answer to that.
Oh, okay.
I'd be really curious too.
Okay. We included it as part of like the resident and medical student didactics. So it's like something they are required to attend. And the way we talk about it is focused on like safety versus like firearm ownership. And so there's literature also about like what's the best way to phrase asking the question so that it focuses more on safety so that patients are also more receptive of it.
That makes sense. Yeah. How about for y'all, Sami? Was it different for y'all or specifically for March for Our Lives?
Like how to get like effective messaging? Oh, sorry, can you repeat
Yeah, so what was effective and not effective in terms of getting people to show up to live events for you?
I think for like getting people to turn up, it was a matter of like making things accessible for young people. I think gun violence is a very unique issue because not only is it very high on the priority list for Gen Z when it comes to how they vote, reproductive justice, gun violence, climate change are some of the top issues that young people care about and are very important whenever they cast their ballot. And gun violence is unique because like in 2018, especially after the Parkland shooting, March for Our Lives was formed, and that was in an era, like in the light of social media, that young people have a finger on the pulse of social media, and they are able to organize very quickly. Some of the fastest digital campaigns that we have ever seen occurred on social media, of course, and gun violence prevention, especially through March for Our Lives, was truly pioneered by young people. And I think that getting young people to show up is a matter of giving them the opportunity in the first place. I think young people are passionate. They want to show up to events. They want to be in person, of course. I think it's just a matter of having that open invitation and making it accessible for young people. Funny story is like this event alone opened up so many opportunities for me, and that was because this was an open invitation as well. I came here, I think, for the first time in 2021. I was a sophomore in high school. I was working for March for Our Lives, Houston. It was my first networking event. I still remember chasing down some random person in a parking lot trying to get their contact information, and it's kind of crazy how full circle it is. Like now I'm able to speak at this panel up here. So just like this goes to show that when you open up the opportunity for young people to show up, like it really pays off in the end. And one thing I will say is that like, I mentioned in the introduction that I was the chairman for the Harris County Safe Schools Commission. I used what I learned from the presentations that were given here on pediatric gun violence data, on ERPOs, on domestic violence in my interview for the position that I had for this position on the commission, and that is how I'm able to be here today. And like actually half that position was because of this event. So
That's so
very
cool.
full circle, and just overall, opening up the invitation for young people is how you get people to show up in person.
Oh, that's such a nice, like, I feel like Dr. McKay's somewhere, I don't know where she is, she's probably tearing up on that story. It's maybe because you were a sophomore in high school in 2021, that makes me kind of tear up too a little bit. And now you probably have one of the coolest mustaches. I'm trying very hard not to. If I do it, I apologize, but I'm trying very hard not to say I mustache you a question. If I do it, I apologize, but I'm trying very hard not to. But that was a great answer, and it is really nice how full circle this FIPS symposium has come. One thing that I'm seeing here, and I think a lot of people are passionate about, is a question of what advice can you give youth to get involved in this space? And one thing I've heard speaking to each of y'all is the power of good mentorship. And I will say, I won't say it to you, I'll say it to the audience. These are very, very accomplished young people and very motivated young people. But if you ask them, they will say that they got so lucky and that they didn't do anything and everyone did everything for them and they're just so fortunate. A lot of imposter syndrome on this stage, let me just tell you. But let's just put that aside for right now and let's just pretend you're speaking to a younger version of yourself, maybe in high school, maybe in college, whatever it is that you want to visualize, and ask that person who might be a little, they want to help in the fire injury prevention space, they don't know how, there's so much negative stuff out there, Gen Z cares about it, but they feel powerless because there's nothing that they could do. And there's sort of like a hopelessness there. What do I do? What can I do? Asa, how would you answer that question? I'm giving you the hard ones on purpose.
I know it.
Yeah.
If I was looking back at myself, honestly, I've been there. If I was talking to myself, I can't look back on my life and say I would change anything. I'm grateful for everything that I've been through, especially in this space, from teaching grant writing classes and learning how to grant write, to knowing what that process looks like, to knowing when the overhead is not approving of something, but being at a young age and noticing some of the underlying, being transparent, racism, oppression, but being able to see those through black and white. It's not somebody standing in your face and telling you you can't have this. It's a stamp on a piece of paper that you're not getting funding this year. Or, when I see a grant that doesn't get approved, I think of all the youth that, we've, of course, under-promised to overperform, but still wanting to overperform and can't do that to a lack of funding, situations like that. So, honestly, I would just say, and we've had this conversation, I feel like as a good mentor, you have to know when to be bold and when to fold. You can't look at a youth and say, this is what you need to do, or put this down, and don't give them the opportunity to pick something up, whether that's experience on their own, whether that's a book, whether that's opportunity, like he said, or whether that's financial gain, whatever that is, you know, they still have to pick something up. You just would hope that that would be something positive.
Yep.
You know, you would hope that that would be something in the right direction. And so I feel like that comes down to, again, you know, we've had this conversation, having an understanding and equipped mentor. Anybody can be a mentor, but that doesn't mean you're efficiently being a mentor. You know, being a mentor doesn't mean that the work for you stops. You still have to be able to look in the mirror. And so a lot of mentors aren't capable of doing that. So we get in situations where, you know, we have all these different organizations and programs who are in it for the funding. You know, it's not necessarily about the care. It's not necessarily a thing that they're really passionate about. And it shows. It shows in the work. It shows in the streets. It shows in the office, you know. So me talking to the younger me, I would just say keep going. You know, all my personal experiences is what put me on this stage today. And I'm grateful for those things. Whether it was a up or down situation, you know, it's ups and downs on a roller coaster, but that don't keep you from sitting in line.
Yeah, I think I told you, well stated. I think I said within 5 minutes of talking to you, I was like, I can feel the positive force that's coming out of you, and I was like, oh, I wouldn't want to bet against this guy, you know. Actually, and I would say that's true of everyone on this stage, which brings me to Rithika, who also has spoke, when I asked her, you know, how did you, you know, what are some of the things you did, went on a whole thing about how great her mentor, Dr. Katie Wiggins, a trauma surgeon in San Antonio is, and I'm sure she is great. But I guess my question for you would be, knowing your story, you kept on leveling up every single stage of your medical school career, always going on to the next, never dropping this curriculum idea, no matter what the setbacks were, when other opportunity came, I would say, seemed like you had the courage, maybe would be the word, I don't know what the word would be, to take that next step, even in the face of maybe a little uncertainty. I don't know if that's fair or unfair, but one of the questions I have for you, Rithika, is going to that first-year medical student who's about to start medical school and doesn't even know where the bathrooms are and is just terrified of anatomy class, how do you tell them what should they do? Because at the same time, they do want to get involved in this space and they do want to do great things like all of y'all have done.
I guess for me, like the world that I was in was like the medical school world, and so there was like a clear need for this project, and I was looking for something that I could work on that would also be like fulfilling for me. Yeah, because you know, it's such a complex issue, but here's this like kind of specific topic, which is like secure storage or firearm safety in relation to that, and I could like learn about that. And even when I was like giving the curriculum presentations, like sometimes when I would do it for like the residents, and if there was no one else that could make it that day, it would just be me. And sometimes I did feel like a little intimidated because I didn't have the clinical experience that they had even, but I knew like, okay, I know about these storage devices, and I know the information that we're presenting and why it's important, and I feel like I can communicate that. So I think focusing on like what I did know, and then being open for like different opportunities to kind of build on the work. So just like making connections. I got connected with the Texas Doctors for Social Responsibility organization, and I feel like through that I've been able to participate in things like this and just meet more people that are involved. Yeah.
That sounds good. Openness, maybe? Just being open to the idea. Millen, specifically for research, you know, you're, I'm not gonna ask how old, I promised myself I wasn't gonna ask how old anyone was on stage, but you're a recent graduate of Rice University. And you've already engaged into the research world in a way that maybe some of your peers haven't had an opportunity to do yet. Looking at a freshman in college, they want to get into research, they want to do it in fire injury prevention, or maybe not, but what do you tell them? You know, how do they not just have the typical undergraduate experience, but take it to that next level?
I think what's important is find what you're passionate about. If you like even feel like the smallest inkling that you might be interested in something, just go for it. I wasn't always interested in firearm safety, but I felt that tiny spark, and I decided to go for it. and then once you do, connect with people. We had amazing advocates, community partners, researchers present throughout today. I promise you they're not gonna like gatekeep getting involved in this space. This space is an area where there's so many passionate people, and we want more passionate people. So just connect, reach out, send that email.
Well stated, yeah. What do you think, Sami? I mean, do you agree? I think you specifically have a very tragic, but also very powerful origin story that came out of your community and your neighborhood. I'm sure other people in your community have that same passion for making a difference, but might not have taken the same steps you did. How do you bring other people along on that journey?
Yeah, I think it's really a matter of, like you mentioned, speaking to yourself as a younger version of you, and I was thinking of like, what would I actually say to a younger Sami who was very bright-eyed but didn't know where to get involved? And I would say, like, you need to get involved. If you don't see a mentor, it's okay to break into spaces where you don't see other young people. And I think Gen Z is very unique in that we look for opportunities and build our own opportunities. And one story that, Ritka's heard this before, but when I was a junior in high school, it was my first experience with the Texas legislature, and I wanted to do something with the legislature, do something physical, like have something tangible, results come from a bill. And our community organization, March for Our Lives Houston, had not approached the Texas legislature before. No one had ever testified or worked on a bill before. So I spent my first semester of my junior year just working on one bill and researching the legislature. What is a committee? Like, what is the text? And I actually worked on, which was mentioned earlier, it was a bill to close the boyfriend loophole on the state level in Texas. And I found online resources, I put that together, and then I sent emails, and I got response from Representative Goodwin, who's actually on the next panel, and they took my bill, they filed it, and one thing I will say is, like, I got the call that the bill had been filed during a school assembly, and I remember getting up and getting on the phone, and the person who answered, Tabitha Aditi, who was their policy staff at the time, had no idea who I was, of course. Like, I was just a child, and but they didn't know my age, and I think speaking passionately about the subject, they could not tell that I was a young person. They could not tell that I just got out of a school assembly. Actually, the school assembly was still going on, and I think what matters is that, like, if you're passionate about something, do not be afraid to build your own opportunities, and when you break into a space, bring other people with you. And I think that second part is so important, because sometimes, like, you are the only person from your community to be able to provide a platform, and you need to make that platform as big as possible. And I actually worked with someone from Diet Houston when that bill received a testimony in Austin, and she was able to talk about the community experience of South Asian women in Houston during the testimony. That was very powerful. But while the bill was not passed, I was able to teach the legislative process to younger people in my community, and I think that was the main benefit of going through that journey. So bottom line is, bring people with you, and that's how you create better opportunities.
Well stated, yeah. Well stated all around. One of the things I keep hearing over and over, unstated maybe, is don't quit. Don't ever quit. It sounds like you guys just, none of y'all quit, ever. It sounds like y'all always, if you're thinking about sending the email, you're thinking about talking to the person, you're thinking about doing the thing, you guys do the thing, right? Like, you guys seem like four people who will always just do the thing, and if it doesn't work out, it doesn't work out. And the other thing I'm wondering is, it doesn't feel like you guys ever feel bad or sad. You guys are always optimistic all the time. 100% of the time, always optimistic, never
I feel
sad.
like you setting me up to tell you the truth.
Go ahead. I was kind of half joking, but go ahead.
Yeah, the work definitely gets stressful. I mean, I literally sat on a panel in Minnesota and talked about, organizations that are doing everything that they can, reaching out, partnering with all different types of organizations, bringing in as much funding as you can, and you feel like you're not going anywhere. Feel like you're still on the hamster wheel. And I tell people all the time, that's called perseverance and faith.
Amen.
That's a test you're gonna go through with anything. And I feel like being in this space is better for me because I have people to talk to about that. Like we're all in here going through, no matter big, small, medium, whatever size level of youth violence prevention or violence in general that we're dealing with, you have to talk to somebody. And I feel like having an open community, an open space has really brought me a long way, and actually kept me out of a lot of violence. I was in the My Brother's Keeper program at 14 years old. Well, that was at 16, 17. I was already working for the city of Houston at 14 years old. Working for Councilmember Wynn and doing constituent work, moved on from there to work for Councilmember Boykins, moved from there to do some work with Rodney Ellis, Sheila Jackson Lee. So I kind of already had a background before I even had my deferred adjudication. So I was groomed already, and I feel like that's a blessing in itself. I didn't really, at that time, I didn't know how much of a blessing it was until now, sitting on this stage and traveling and speaking and working with youth. But that, I feel like, was destiny for me. I feel like that was set for me. And so I always tell people I didn't have an opportunity to join this work. I had an opportunity to stay. Yeah. And I fell in love with the work. I fell in love with the people, and even the youth that I work with now, those are my brothers,
Yeah.
So creating what I call family, outside of bloodline, outside of what's right or wrong, but knowing your mission statement for individual, for self, and bringing people along who have the same like-minded experiences and motivation to be where you want to be. I mean, there's no better place to be. You're going to always deal with problems. At
Yeah.
least have somebody you can trust standing next to you.
Yeah, one of the things y'all say over and over again, both privately and here on stage, is how many other people, you guys have connected with, how many other people you guys have, that you guys interact with, and both you guys have helped, but that have helped you, but I'm guessing you guys helped these people a lot too, and probably brought a lot of inspiration. So just to close out then, I think we have like 3 minutes. This is, I think, a great question that one of our audience members asked. What are the organizations or points of contact for people who want to get involved in gun violence prevention? And I'll say, like, what is an organization that just sort of, shaped you, that's still around and still needs help and still needs people like our audience members to reach out to them, that you feel like you want to shout out, that really bring your heart joy? We could start, Asa, Asa, dang it, Asa, we could start out, and then we could just go down the row.
Of course, the Forgotten Third. I know that My Brother's Keeper is still around as well. But, the Forgotten Third is the 1 out of 3 people who don't recidivate, who don't go back to jail, but never get monetized or publicized or rewarded for what they have done. We always talk about the 2 people who do go back to jail and kind of, monetize statistics. So I do feel like the Forgotten Third has helped me a lot. And when it comes to going from a boy to a man, I was able to, I went through a lot of transitions while I was working there. And being a mentor, Mr. Carlton Harris is my mentor. So going through real life situations of, meeting my wife and moving back home with my aunt who's 89, who has dementia, different things like that, but also being able to have a mentor while mentoring others. And that helped me tremendously. But even then, I still wonder sometimes, who is Carlton's mentor? Who does he have to talk to? Sometimes I think about, the lack of funding, will this last forever? And I know that if I'm having these thoughts, my youth are having these thoughts as well. So I always try to get as many resources and as many people, collectively together to help the organization, not just for me, but for the entire community. It's a family thing, and so I wanted to really stress that to the world, that this is a family thing. Like, even though we're dealing with paperwork and politics and stuff like that, you know, we still have to keep love in the situation.
Yeah.
And that's what we do at the Forgotten Third. You know, it's where love happens. That's our motto.
I love it. Yeah. How about you, Ritika?
I think for me, I would say like March for Our Lives, because I think that was my first, I guess, exposure to what an organization could do, particularly for young people and how they can be involved. And that's really like going to like different rallies with them in my hometown was really where I was like, could see like kind of the power of like youth involvement. And then I'd also say like some of the organizations that are focused on more like secure storage, because that's my thing, I guess. So like Be Smart, Lock Arms for Life in Austin is really focused on secure storage specifically. And then there was one more, but I forgot, which is not good. But
And I know we're short on time, but Millen, what do you think?
Yeah, I'll keep it short and sweet. I encourage everyone to reach out to JJ from Brady Against Gun Violence. She's part of the community partner relations staff, and she'd be awesome resource to connect with for research projects, but also just community advocacy in general.
Nice. And Sami, who's your shout out?
Echoing Ritika, March for Our Lives, March for Lives Houston, in Houston, of course. A couple others, Giffords, again, Brady, Team Enough is amazing. Texas Gun Sense is huge. Also researchers, because there's a lot of researchers here and they need RAs. And
they do.
Also, just email people, cold email, it opens up opportunities. What do you have to lose? Your career, it hasn't even started. So just email them, yeah.
Good.
Yeah, and you know, it's a lot of partners in here too. So if you don't know the person next to you, ask them who they are and what they do.
Yeah. All right, y'all. Let's give a round of applause for our esteemed panelists. And I think we're going to have a short break. We'll be meeting up again at 2:50.
Thank you, everyone. This has been an incredible day. And to read the messages that are coming off of my phone, this gives me hope for the future. So I am incredibly inspired by our past panel. And I am excited about our next panel. So I am going to bring up Dr. Shannon Gio-Wright, who is an associate professor with UT Health School of Public Health and the director of health policy at the Violence and Injury Prevention Research Center. And she is going to introduce our next panelists, and we're very excited and honored to have them with us today.
Thank you so much. I am very excited about this panel. We have Representative Vicki Goodwin with us today. And she is serving her 4th term in the Texas legislature. And I think many of you know her already. She represents many parts of Austin and the Lake Travis area. And she has been a steadfast advocate for gun violence prevention and consistently pushes against special interest groups that seek to weaken Texas gun safety measures. Vicki and her husband are empty nesters now, and they raise their kids in Texas. What I love about our panel is that they are also from Texas and went to school here, and so they really understand the different issues. So she's a graduate of the University of Texas and earned her master's degree from the LBJ School of Public Affairs. Then we have Senator Molly Cook. Yes, please. She is a 6th-generation Texan, born and raised in the Houston area. She's a registered nurse and grassroots organizer. She earned her nursing degree from the University of Texas at Austin and her dual nursing and public health graduate degrees from Johns Hopkins University. And as an emergency nurse and grassroots organizer, Molly has advocated for the health and safety of her neighbors and she is honored to continue that work from the Texas Senate. Molly's community advocacy helped pass a citizen-driven amendment to the City of Houston Charter, and she has been recognized by the Houston Chronicle as one of Houston's transportation leaders. She is also a harpist and multimodal transportation enthusiast and certified yoga instructor. So thank you so much for being here. So I am going to start off with a question that I hope starts to humanize all of us a little bit more. I think sometimes we think of our legislators as people who are have a lot of power and are sometimes not accessible. You both are clearly accessible as you're here today, but you also have your own experiences with firearm and firearm prevention and why you got into it and why you're here today. So I would love to hear from both of you about kind of your own personal experiences and how you came into the policy space and then into this specific policy realm.
Yeah, for sure. Well, I have been working on gun violence prevention since I got into the legislature, and one of the main reasons is it's very personal to me. In 1990, my dad was shot and killed in our home in Dallas. And so I know what it's like to lose somebody so unexpectedly, so tragically. And so I can understand other people who have lost loved ones and empathize and understand that really we want to make our communities safer. We know in Texas that people often will say we have this gun culture, but I think it should be we have a kid safety culture. We need to turn that conversation around. The first time I went block walking, I knocked on a door of a teacher, and she shared with me a story about one of her students who would not sit with his back to the door because he wanted to be able to see if a shooter came in the door. And that impacted me greatly. And then my kids went to school, and when they were very young, we didn't have active shooter drills in schools. But as they got older, we started to have them, and I just thought, this is such a sad statement that we have to teach children how to respond to a shooter in their school. And so my first session with Donna Howard, she was really working on the issue as well and was working on safe storage and working on education. So having even the DPS provide a public safety announcement about storing your gun safely, because honestly, so many of the injuries and deaths are accidental or suicide. And so we thought this is a way to get something done. And her bill didn't pass, but she was able to get $1 million into the budget. And so through that $1 million, the Department of Public Safety put out that public safety awareness campaign, which they're continuing to do still. But I just think when we've had the Uvalde's families come to the Capitol and advocate, I want to be there to help them navigate, because the process for passing legislation is so incredibly complicated. We said the way to get a bill passed is to go meet with every legislator, whether they're on your side or not. And yet this session, I had to be honest with the families and say, the makeup of the House committee is not one that I think we're going to get a whole lot done this time. But for me, just being able to share that I've been impacted by gun violence, I think helps the folks that we're trying to work with, all of the victims, and we see that number growing all the time. People who either have a family member or a friend or somebody that they know who has been impacted by gun violence continues to grow. And so this is an issue that everybody cares about, but it's not always the first thing you put out there because it's a very heavy topic.
Yeah, and I'm State Senator Molly Cook, and thank y'all so much for being here on a Friday afternoon to talk about the most important thing in the world. So my whole entree into politics, period, is through nursing, and I'm an emergency room nurse. And so I don't have some landmark moment or a super close person that was taken by gun violence, but I bet every single person in this room has some sort of connection. My friend's dad committed suicide or killed himself with a gun. and that sort of thing. So you start to look around your social network, and all of a sudden you're like, oh my God, there's actually quite a few people in my next circle out, if not in your closest circle. And then the same thing happened in my nursing career. And I have a patient, there are so many patients that you keep with you, they're kind of always in your heart. You can always call them back up anytime. You always remember what room number they were in. But, and he had a spinal cord injury from a gunshot wound. And he lived with a colostomy, a urostomy, paraplegic, et cetera, full life. People with disabilities live super full lives, but very difficult. There was a lot of challenge that he faced on a daily basis from that moment on. And he just kind of shared with me as a 22-year-old nurse what that was like. And that was the first time I'd really felt it, seen it, put my hands on it. And then to look back over a 10-year career and how many people I met that live with a bullet inside of their body the rest of their lives. Don't know if they can get an MRI or not. People who've lived with severe injuries, people whose families have disabilities for forever, that it's just now part of their lives, it's baked in. And slowly, as we've all experienced the rise in mass shootings, obviously we know 2/3, right, are suicide deaths, we know that, but the rise of mass shootings is something that is culturally very significant to people that has never existed before. It actually does set these generations apart, and the number of intrusive thoughts I have on a daily basis about gun violence, even having never been in a situation of mass shooting, it's just, I know if I'm thinking these things, if I'm scared to be in a crowded room, if I have second thoughts about going to the movies, everyone else is too. And the reality is, if you know much about public health and molecular biology, it's really bad for us to be walking around with that level of cortisol every single time we make a decision about walking into a shopping mall. So to me, I'm so angry. I'm so angry that people have refused for so long to take actions that we know will work. We don't need a study. You can see it all over the world, what works and what doesn't. And why, when things like universal background checks are supported by 85% of Texans, why are they not passed? And that's a reason to run. And everybody in this room should be thinking about running for something. We need people running at every level of government. So anyway, all that's to say, I think every single person in Texas has personal experience with this. And it's very, very deeply rooted into all of our psyches, whether we've done the work to unearth that or not. And I just can't wait for change.
Thank you both so much. I wanted to kind of pick up on a couple different points that you've each made, and we'd like to dig into that a little bit more. And that was both about this past legislative session and what couldn't be passed, as well as how people can go about that process. So you talked about, going and talking to every person, every senator, every representative, whether they agree with your message or not. So I'd like to kind of understand how we put that together a little bit more. So for people here who are thinking, I want to engage in this, I want to do something, but I don't know how, can you give people some different strategies of what you've seen work, and then things that may have worked in the past that might not work in the future, and that we might have to change how we've been doing things because of our current environment?
Yeah, well, I would say a lot of the success of a bill depends on the composition of the committee that's going to hear that bill and the composition of the legislature, to be honest. And I think a lot of times the media doesn't start talking about a bill that's going somewhere until it's too late. So like if you're following the news and you see, oh my goodness, they're about to legalize short barrel rifles, for example, by the time that hits the news, it's so far in the process that there's not a lot that can be done. We need to start the work earlier. So starting the work during the interim, which is right now, of reaching out to members and finding out where you might find support, what ideas might work, and so forth. And then early in session, going and doing the work of meeting with members at that time. The one bill that has passed while I've been on the Homeland Security and Public Safety Committee that was addressing a specific shooting was when the Midland, Odessa shooting happened. The shooter drove around town and shot up at several different places. And the family that lost a son at a car dealership came in, and during the hearing, they told their story, and that was very impactful. And you would think the same thing would have happened when we had the Uvalde shooting. It did, but slight differences in that with Midland, Odessa, the bill that came from that was an alert system. It really didn't have anything to do with guns per se, but it said this family poured their heart out and said, if we had only known the shooter was driving around, we wouldn't have gone to that car dealership and our son would be alive today. So what came of it was a bill that said, okay, DPS can put out this alert if there's ever a shooting and let people in that community know there's an active shooter on the loose. Well, guess what? That got enacted into law and has never once been used. And there was a situation in Austin where, honestly, it would have been helpful and maybe it would have saved lives. And I reached out to the police and to DPS and said, I don't understand why you didn't implement this law. It might have saved lives in my district. There was a woman and her daughter who were killed in Circle C, which is in my district. And that was after the shooter had gone to a school. So wouldn't it have made sense when that shooter was at the school to put out that active alert? And the police response was, well, if we put out an active alert every time there's a shooting, people would be numb to it. That was their response. So that was a bill that did pass. When the Uvalde families came, it was just, nobody believed that we would have the votes to get the Raise the Age bill passed, and yet I sincerely think we had the votes in the House. Leadership didn't want it to go too far because I think leadership didn't want to have to take a tough vote at that point in time. Honestly, I think it will take a change in leadership, and I will be specific. Governor Abbott, Lieutenant Governor, and for that and many, many reasons, I am running for Lieutenant Governor. I hope it's okay for me to say that.
Yeah.
Because, they will make it known, this is not a bill I'm going to pass, and therefore, it's very different in the Senate. I feel like members have a little bit more ability to debate and vote their own mind in districts in the House than in the Senate, and I'll let you speak to that. But, so I guess in all of that, it's coming and advocating, yes, but there's just certain people who aren't going to change their mind. But doing the work that you're doing, getting more people to join the organizations that you're in, whether you're with Moms Demand Action or Everytown or Texas Doctors for Social Responsibility, there's so many organizations to plug into, and that's the best way to advocate because they know now's the time to go talk to this person and here's what to say. And so it's easier to advocate when you're with an organization.
That was all great. Echo all of that first. And anytime I'm in a gun violence prevention room, I'm just like, y'all are super well organized. So it's almost more like take specific questions about what you think are next steps for your organizing. Because I actually think this is one of the best organized spaces that I've ever spent time in. And your strategy's solid, the polling is there, you're building momentum every single day, and we have just not reached the power shifting tipping point yet. Wherever that is, it remains elusive. Because it just, to me, seems like there really is overwhelming support for good policies. So if we're talking about shifting power, then we've got to think about what is the next step. And again, there is no criticism, no notes in this room, because every single time the strategy evolves and advances and does exactly what it seems like it should do from my perspective. But I do think it's going to be easier to flip a statewide seat to, we'll stay nonpartisan, to someone who supports gun violence prevention than it is to flip some of these House seats and some of these Senate seats. And so we have to be doing the work, again, no notes for anyone in this room, but just kind of in general, of bringing in people who are not super political and bringing them into these spaces, giving them a home, and inspiring them on the issues. And so I just say, any specific questions you have, probably most of y'all are my constituents, and we're here for you. We are here for you to bounce ideas off of. I'm not tired, I'm angry, so please feel free to reach out anytime, starting now. But, let us know, what were you curious about? Who did you feel like you had some movement with? Which staff member did you connect with? We can try and talk to you about what that looks like. If you need, fundraising for your organizing, if you want to start to do stuff on your own block to try to bring in some more people, it's not simple math, but we do have the voters that we need in a couple of big districts in Texas to flip statewide seats. And so what does the work for the next 5 years look like? And to me, it looks like year-round door knocking. It looks like organizing. It looks like showing up at people's doorsteps who haven't voted in every single Democratic primary or haven't voted in every single presidential election, and asking them what's going on and how can we serve you better, and kind of offering before we ask. But I think that this, public ed, are probably the two biggest issues that need grassroots organizing in Texas right now, where we're going to find a lot of overlap regardless of party. And it's super important that we do it, and I'm just always thankful to be in the room with you guys. I just can't tell you how good it feels to come home from Austin and be in a room with y'all. But yeah, I just think we have to stay relentless, and we need to find the folks who aren't already in the fight, and start thinking really strategically about who are, in a very nonviolent way, who are our targets? Which members do we think we can move next session? Who is in their fraternity or sorority? Who goes to church with them? Who plays in their mahjong circle? Whatever it is, how do we get to them and start moving the needle on these people? Or how do we stand up a candidate in their district that's a threat to them, that runs on gun violence prevention, so that is the issue that they're having to wrestle with in their district? And I know you guys are already working on most of that.
So you said something right then, you said to stay relentless, and that connects to a question that we had from the audience. They said that no gun violence prevention bills were given a hearing in the last legislative session. What makes you keep going? What makes you continue to be relentless in this space?
You know that there's always going to be change. Next session will be different in one way or another. And so it's the hope that, okay, we're going to really reach out. And last session, it was Representative Sam Harless who took the brave vote in committee for the Raise the Age bill. He's a Republican, and he previously would not have voted for that bill in a prior session. So what moved him, since I sat close to him on the floor, I asked him, what changed your mind? Why did you vote for that bill? And he said it was my grandchild. He showed me a picture on his phone. That's what I think, when people see that it's starting to impact their kids or their grandkids, that's when they start to use their heart. And what gives me hope is that people can change. And every session is different. And I know that we will get there at some point to create more safety around this. Some of the bills that passed this session, the vast majority of Texans don't agree with, like allowing people to carry a gun into a polling location. That's so crazy. That was one of the bills that passed the House. Thankfully, it didn't pass the Senate. But I just think the vast majority of people agree we need some responsible legislation around it. Another one that passed the House was not banning cities from having gun buyback programs. Like, why would, even if you love your guns, we're not saying you have to go sell your gun back. We're just saying a city might decide to have a gun buyback program, and why would you not allow that? But there's another bill that passed the House. I think it passed the Senate too. Yeah.
And the criticism was the use of local funding, and they were ARPA dollars. Every one of those pilots was federal money. Yeah, I would say, so I'm so proud and honored. I'm the youngest Texas senator, and I feel very, very strongly called to vote no on every single bill that expands the rights of gun ownership, every single bill that puts more guns in more hands, every single bill that adds more bullets to Texas. So I'm staunchly opposed. I don't care how small it is. I vote no on them because I'm so sick of it, and that's where we're at as a state. It is my honor to come in behind people who have been doing the work for decades and have stayed hopeful and have stayed relentless and have made progress. And the Senate is a tough place, but you have a staunch gun violence prevention advocate in that chamber. And I'm going to speak on all of them, and I'm going to annoy everybody if they're annoyed by that. I don't care what time of the morning it is, because it needs to be said and things need to change. And so it was a tough session, but you did add a member to a chamber who is willing to die for this. And that is a win. That's a win for our communities. It's a win for gun violence prevention. It's a big deal. There's different kind of places that we make progress and count our wins, and you have to celebrate them. You got to be together always. You cannot fight this stuff on your own. You are always in community, because there's going to be days when you completely despair and you are useless to your team, and that's okay. You need to go to sleep, go on vacation, whatever it is. Your team will carry you, and you'll be there for them on the day that they need it. So you've got to be in community with one another. And then I think look into the young folks. And normally I hate that. I hate putting it on the young people to save the world that older people handed to them. But on this one in particular, there is such a shift. There is such a power to the youth who are growing up in danger that they shouldn't be in. And they are fighting in a way that is really inspirational. So I look to my heroes who've gone before me. I look to the youth coming up, hopefully running for office soon, younger than I am. And then I just dig in deep and link arms with my teammates. And that has so far worked.
Thank you so much. When we were in the hallway, I think it was you, Representative Goodwin, who said, people do care about safety. And, it's about thinking, how do you get them on your side? And so can you talk about some of that work that you've done where you can think about it in larger terms and being able to pull people in who might not be the most obvious supporters?
Yeah, sometimes I think it's saying, okay, if we can't touch the gun issue directly, maybe there's a way indirectly to touch it. And I'll give an example. In my last session, I had a constituent who was shot by a man she dated twice, and so we passed a bill in her name, the Natalia Cox Act. Doesn't have anything to do with guns, though. But sometimes you have to think about, how could we have protected this young woman? She was threatened by this man she had dated twice, called the police, they showed up, he left, but unfortunately 5 days later he came back, got into her apartment and shot and killed her. So she had gone the day after he threatened her initially to her landlord and said, I want to switch apartments, I don't feel safe here. Unfortunately, the landlord put some hoops up in front of her, said you have to reapply, you have to pay a new application fee, a new security deposit. So too many hoops for her to jump through at a time when she was in college, young, just didn't have the resources. So for us, it was, if she had just had the information that there are organizations out there to help, that she could have gotten a protective order, she could have exited her lease agreement, even though they were putting barriers up. So what we did is we made sure HHSC provides that information, so you can go on their website and find the resource that says you can get a protective order. If you don't have money for an attorney, here's the number you can call. It provides phone numbers for organizations that can help, and it lets you know you can get out of a lease agreement. And so it's just meant to give young people in particular that information, how to keep yourself safe. So I guess, in a session like we had this session, things like that, if it has to do with sexual assault or domestic violence, those kind of bills seem to get bipartisan support. So that's kind of where we have worked. That's the lane we've worked in at a time when we know talking about guns and any kind of a restriction on guns just isn't going to happen. So it's kind of figuring out other ways to make our community safe.
Such a good question. And I think because I'm in the Senate, I don't know the answer. I have not had the opportunity of changing someone's mind on something. It's just such a different space to be in. 31 big characters in there. So let me take this opportunity to just say something that I have just not heard talked about at all, which is the fact that the Senate State Affairs Committee had one Democrat, which means there were It's a big committee. I can't remember how many members. I don't know, 12 Republicans, something like that. And I know we're in a nonpartisan space, but I think you all know how they vote on gun stuff. And that's nuts. I mean, this state, even recently, right, was like 49-51, Republican, Democrat. It's not like there's some huge chasm between us. We are, all of us are about a half and half state with just enough to get somebody over the edge, right? And so how are you going to put one Democrat on the State Affairs Committee? Arguably the most important committee, the biggest bills go through there, the biggest social impacts on people's lives, and you've got one person. And that's a lot of pressure on that one person. You might even call it cruel to put one person by themselves on that committee to take every single bad messaging vote, considering on how you're looking at it. And so I don't know how you change somebody's mind, but I do know that we need to work ourselves to the bone to change who's in charge. Thank you. We need to change our statewide leadership, and we don't have to change everyone's mind. We only have to change 50% plus one. That's it. So, yeah, I don't know. Like I said, I'm fired up. I'm ready to work with y'all. Some of these minds aren't going to change, but you can change who's in that seat.
That's a perfect segue to this other question. So I know we've been talking a lot about this last session, or work that you've done in the past. What can we do during the next 19 months when we're thinking ahead to 2027 to encourage the legislature to reduce firearm violence?
Well, organize, and again, like Senator Cook was saying, bring in more people to your organizations. Like, take advantage of this time when there's a lull in the legislature to really do your organizational work. Get new members, do something social to get people interested, then tell them what the work is that you're doing, that we're trying to put in sensible mechanisms, whether it is making sure everybody goes through a background check, which the vast majority of Texans agree with, whether it is having a buffer zone around schools so that someone can't openly carry a rifle right around a school, which is federal law, but it's not state law. And we saw people in the Austin area, it probably happens in other places too, where they will openly carry a rifle close to a school. And you can imagine the concern that creates. But they know it's almost like they're tempting someone to come and tell them they can't be there when they know there's not a state law around it. So I think just talking about what is it that legislators like myself have been trying to do to increase the safety in our communities. There's also a lot of gun violence prevention programs, dollars that go into programs where people go to hospitals. Someone's been shot, that they're more likely when they get out to perhaps retribution. And so trying to break that chain, I guess. And so there's a lot of programs that are being done, but just making sure you're educated on all the work that's being done and then helping to spread the word about it, and then talking about which candidates. Oftentimes I find people don't know who their representative is at the state level in particular. Oftentimes they know Congress or they know city, but state not so much. So maybe letting them know, here's who your representative is now and here's how they vote on these things. Because I have found in the past, people don't know who their representative is, they don't know, and then if they do know the name, oh, I saw their pretty picture on the billboard, that must be a good person. Well, did you know that they voted this way on this issue? And they're like, oh, no, I had no idea. So it's just educating people.
Yeah, I think there's a real feeling of all of the work happening in 140 days, which I always suspected wasn't the case, and now know more than ever that that's showtime. That's the big show. And you've been preparing for 18 months for that moment, and there is some like learning and growth that happens, until the filing deadline, and then I think most of the learning and growth at that point kind of stops, and it's time to move your bills. And so I do think, in general, again, not this room, but in general, the organizing community in Texas really needs to think of the interim as the time to get the most work done. And you're going to get an hour-long meeting with a legislator instead of a 10-minute meeting. And there's just a lot of repetitive work that can be done. Someone shared with me one time, you think it's super powerful to take 20 people to city council and give comments, and it can be. but it can actually be a lot more powerful to have 2 people go to their office every week for 10 weeks, because then it looks like everybody feels that way, which they do. We know they do, right? But starting to think about like reflecting on the work that you did this session, what skills are you currently missing? Are people on your team adept at, voter data? And do you know how to target? Do you know how to pick doors to knock on? Do you know how to kind of understand who is who in your universes and that sort of thing? If not, then now's the time to start beefing up some of those skills and making sure all your folks know how to build and cut a list. And is your messaging on point? Do you need to do some like A/B testing in this meantime to make sure that when session hits, you've got the right language that you're using and coaching people on? Bigger groups have access to some of that stuff. Smaller groups usually do not. And again, we're here to help you with that. We want to help you knock on doors in your neighborhood. We want to help you communicate to folks who are not already in the political process about what's going on. And then I think also just all of us kind of understanding and poking our heads up and looking around at the greater organizing ecosphere. So if we bring people in who vote certain ways on certain things, they're also going to vote with us on gun safety, right? We kind of know where these issues overlap. And so there's a huge opportunity right now for organizing around cannabis. There's a huge opportunity right now for organizing around public ed funding, right? And a lot of the times you're going to see overlap with that. And so are we kind of linking arms with our siblings in other movement spaces and making sure that we're all building in a way that's really cohesive and that is strategic and does bring in the representation and the political side of things, right? So it's not, we got to have issue-based and we got to have politics. They have to go together. That's the only way to make change. And so are we marrying that? And are we marrying it with the people in other spaces where we can build synergistically and more powerfully? And are we getting into those flippable districts? Are we getting into those movable people and working them all interim long and sending one person a week into their office to communicate with them and share their stories in a way that once session hits, it's a different heart than was in there before. So I'm really excited to do that work.
Thank you. So for people who are here who may work for a state university and they may advocate outside of that work, but within their purview of maybe being a researcher at a Texas State University, how can they engage in this process while at the same time kind of understanding the political sphere and being able to provide different resources or information to you all? What are different ways that you've seen successful engagement?
That's such a good question, because I often feel like there's somewhat of a chilling effect on university professors to get involved politically because you are probably concerned about your job. We did have Dr. Lauren Gamble from, I believe at UT, come and, anyway, she came and testified after Uvalde and did a wonderful job of providing the medical perspective of, we often know about the deaths, but what about the kids or even adults who end up in the hospital with bullets, like you were saying, left in them, and the impacts of those. And so she shared some stories to the committee. I think that's very impactful when you have people that see it firsthand, coming and sharing their stories. I think there's a role everybody can take. It just may be different depending on your job situation. And oftentimes I do hear people say, I can't really get involved because I'm afraid for my job. And if that's the case, maybe there are just other ways to get involved. Maybe it is talking to family, friends, coworkers. And again, the more we can educate, here's a representative that's running for office that would vote this way. Meanwhile, the one in office votes another way. Did you know that? Kind of having smaller conversations among friends that you can trust. So I just think there's always something that each of us can do.
Mm-hmm. That's such a tough one. It really is. And I think the most important thing always, ever, is to just be clear about what you can and can't do, and have that really well thought out in your own mind so you can communicate that to your teams. I did my public health degree and cut my teeth in Maryland at Johns Hopkins in Baltimore, and spent a lot of time at the Maryland General Assembly. And what I saw there was all of their advocacy orgs had a C3 and a C4, and maybe also a PAC. All of them. I mean, that's just what you did. And they just had a good lawyer. They kept the money separate and made sense. Some of the bigger advocacy orgs down here do have that, but mostly not. There's a lot of C3s that are just C3s. And that is really valuable. Like, you need the research, you can raise a ton of money, you can operate in nonpartisan space, super, super valuable. We desperately need some of that C4 PAC push down here. We need it so bad. And so I think there's a line between, it is real. You could lose your job. You could, if you have any other layer of intersectionality whatsoever, you could be in danger, right? And so operating, below the radar or whatever works in that sense. There are some people who are wasting privilege. There are some people who are saying I can't do it when they probably could, especially if they would do the work of keeping their hours straight or of having a lawyer on hand, whatever it is. You can do it. There is a certain amount of time that you can spend doing advocacy work, even if you are a C3, even if you are an academic, et cetera, et cetera. So I just encourage folks, be safe, be smart, keep your teams aware of what you can and can't do so they know how to best utilize you. And then also, if we want change, we are all going to have to take on some damage. It does look like that. And we are in the fight for our lives. We do have really, really bad public health outcomes in Texas. We are bottom of the barrel for a lot of different funding things. We are the epicenter of gun violence in the United States. And so we do need everyone to step up to the plate as much as they possibly can. But that's really tough, and it's easy for me to say. I'm not in that situation, right? And so you just have to be smart. But I will also say that as much as you can let folks know, these are my skills. I can, produce you one-pagers. I can train your staff. I can do all these things without anybody noticing me do it. That stuff is super helpful, and we desperately need you. So, go out there and find any way that you can participate.
To piggyback on that, I was talking to a staffer one time, and we were asking how they like to receive information, and he gave an example of somebody sending him their dissertation, and he was like, there's no way I'm going to read your dissertation. Like, your advisor probably didn't read your dissertation. And so what are ways that people can be smart about the way they get information to you all that you can then put into action?
I can start on that one.
I was going to say, if someone comes to me and says, this bill that was proposed is what I think we should do, and here's maybe how to change or add to it, the more specific you can be about legislation, the better. Like, a dissertation is not telling us how to change the law to make our communities safer. And so it's like, how am I going to take that dissertation and turn it into something that's useful? So if you can come and advocate, hey, this is the bill that I think we should really work on this next session, and here's why, and here's how, and so forth, that's a lot more helpful to a legislator. Be really specific. Maybe there are bills you didn't like, here's why, and here's the impact it would have. But yeah, I think our time is very limited, and we have so many different issues that come before us that the more you can pare it down to a very short ask, a short request. This is what, this whole big, for example, when the families from Uvalde came, there were probably a lot of ideas that they had initially about how they could have prevented that. But they knew that in order to pass something, they had to really concentrate and focus on one thing that they all galvanized behind. And so their message was really very simple. And that helps us as legislators to say, okay, that's what a lot of people are behind right now. Yes.
And communication's a tricky one, because it's like, you can spend all your time thinking about how perfectly to package something or how to say it to somebody, and it's never going to change their mind because they're being funded by a special interest, right? And so it's like, how much time do you really spend on that versus not? But if you're talking about a friendly office and you're sending some info, a dissertation's welcome in the interim. I read dissertations. I've had a couple dissertations that changed my mind on some serious issues and inspired me as a legislator, but not during session, right? That's not going to happen. But I think asking what people want can be really helpful too. So we have a really well-organized office staff. We want everything in an email, as long as it's not, secret and you need to tell us over the phone. But sometimes I think it's very tempting to want to talk to the legislator directly or catch them in the hallway. There is no worse time for me than in the hallway. No worse time at all. I'm just going to be okay, because I don't know who you are or what you're saying in front of people right now, right? So it actually is super helpful to just organized in an email format, and then you can kind of follow up and that sort of thing. In the interim, I take book recommendations. I'll read whatever you give me. My staff will read whatever you give me, and then I think in general, repetition matters. Repetition catches people's eyes or ears. You're like, oh, I've heard that a few times before. Repetition is just absolutely huge, whether that's a massive statewide drumbeat or, again, just having a few people go to the office and happen to say the same things. When people happen to share personal stories that are kind of all the same, you remember it. So I think, and when you're giving stuff to us, obviously it needs to be colorful in one page, right? That's what they always say about legislators, is make it easy and digestible for us. But our staff they're lawyers. They're really, really thoughtful, smart people, and they will chew through materials. But also the most important thing in the world about communication is having a relationship. That's what gets you in the door. That's what gets you 3 more minutes when somebody's got another appointment to get to. That's what makes somebody stop and think twice, is having that relationship. So I think it's just important to always be thinking about who do you know that knows them? How can you build a relationship with somebody? How can you find something that you have in common with them that makes their eyes light up before you start talking to them, trying to establish that human connection with them first.
Can you talk more, both of you, about that relationship piece? Because I think that is really important. It's something we sometimes forget. But for people who might not live in Austin, how do they reach you or your staffers, and how do they build those relationships and connections?
Well, I have built a relationship with a lot of people in this doing this work because of my first campaign. I had Moms Demand Action members help block walk with me. So certainly that's a way to build a relationship is spending time with the legislator at their events. So, find events that you can go to where you will be in the same space and then come up afterwards. I've gotten to know Dr. Jaime Estrada very well because he's reached out. Persistence is very important in this work. Kindness and respect and all of that. How do you build a relationship with anybody? It's being friendly, inquisitive, helpful, all those things.
Yeah, I think it depends on the member. If you want a relationship with me, you've got it. We do not turn down meetings with constituents. We never will. We love to meet with our constituents. It's the best part of the entire job. We door knock all the time. We love to door knock. I just want to be amongst our people, especially after being in that building for 5 months. But I think the question is, how do you start to build relationships with folks who don't necessarily think the same way that you do? And I also think it's persistence. My personal philosophy is always offer before you ask. So no gifts over $25 or whatever it is. But if you drop off coffee for the office and say, hey, I'm so-and-so, I just wanted to meet your ledge director and introduce myself. This is really meaningful to me. I'm from your district. Or you come with your cousin who's from their district, whatever it is. And again, reaching out to folks in the interim first, have a meeting here, a meeting there. Too many meetings during the session, it becomes a bad thing. It becomes very frustrating when the same group wants to meet multiple times, because we do only have so much time and we want to make sure we give everybody some airtime. So I think really maximizing the interim is so valuable. And then again, doing really strategic power mapping, looking through donor lists. Who do you know? Who are you connected to? Who do you see that donates to 2 candidates that it kind of doesn't make sense? What is it that's connecting y'all that made you attracted to both of those people? Finding out where people went to school, finding out what clubs, what boards they're a member of, right? Those are all ways that can help you kind of figure out who do you already know that knows them, how can you how can you get close without seeming weird, and jumping on them at an event or something. All of that stuff you can be really thoughtful about, but I think maximize the interim for relationship building for sure.
Yeah, it sounds like both of you are also really focusing on be kind, right? Like be a human and find ways to connect on that human level.
Oh, and I will also say, if people show up and have really great stuff to say over and over again, they start getting calls. And I know because it happened to me, and it probably happened to a ton of people in this room too. But you just kind of show up over and over again, say the right things, just be super smart, and people will notice that.
So we're starting to run out of time. Sadly, it went by really fast. Before we, start to close out this amazing conference, do you have any final thoughts or words that you can share with us today?
Would you like to go first this time?
Absolutely. I will just say this was my first session. I am home raring to work with y'all and get on these doors. Like I'm just like there's such a long way to go that if we get started, we're going to blow ourselves away in this interim, right? And you guys know this. You've done this work for so long, and now I'm getting to look at all these issues at one time. But I am inspired by your work, and the reason that this session, on paper, maybe looked tougher than last session, and maybe looked like there were fewer wins, is because y'all nailed it last session. You knocked it out of the park. It blew everyone away, and they doubled down, they moved the goalposts, and they made things even more fair. But all that tells me is that the people of Texas want the same change that you do. They are having to get so unfair. They're having to be so oppressive and so dominating in order to keep things the way that they are. You are on the cusp of something absolutely incredible, life-saving, and game-changing. So please keep it up, and I'm so thankful to be here with y'all.
Yeah, I'm thankful for y'all coming out for this event and for all of the work that the gun violence prevention organizations do. Another organization that comes to mind is RISE AAPI. I know they've done a lot of work on this as well. Hopefully y'all are all talking to one another, and hopefully y'all are getting the information you need. If you ever need additional information, like where do we see there might be some opportunities in these upcoming elections to bring about change, you can reach out to us and ask. It's so soon right now that we are still just coming out of the fog of a session. But over time, we'll start figuring all of that out, and maybe y'all will be doing the same thing, figuring out who you want to get behind and how you can be helpful until the next session arrives. But, keep the hope, keep the faith. We're all working towards the same thing. I think the vast majority of Texans want our communities to be safer. We want our kids to be able to go to school without this worry hanging over us that they won't come home. We all have the same goals, and so keep at it. Thank you.
Thank you both so much.
Well, I just want to say this has been an incredible day, and I want to say a thank you again to our incredible legislators for agreeing to come out here, especially after a long session. So thank you for your time and your dedication. I also want to say thank you to our speakers and our moderators for helping to make this day very successful. An extra special thank you to our sponsors, our gold sponsor, Memorial Hermann Hospital, our bronze sponsor, UT Health, and our supporters, Harris Health and Texas Doctors for Social Responsibility. This day could not have been successful without your support. I want to give a special shout out to Katarina Reyes for helping to make this day special for us. The magic does not happen without Katarina. Also to our AV team here at Baker Institute, for all the people who are watching online and also making sure everything is seamless here, and our Baker staff. We appreciate all their support. In very brief closing, I just want to highlight a few of the key points from each panel that I just kind of took home from this. The need is there. We know it. We know that we need to gather evidence, and we need to include all sides of the aisle, right? I heard that we need to be creative. Build out your circle. right? Bring all people in. Don't be afraid to reach out for help. Don't be afraid to send that cold call email. That's okay. They're not going to remember. They don't know you if they don't respond back. It's not going to hurt your feelings. Don't be afraid, right? That's the key point. Be a mentor. Everyone here can be a mentor. Be relentless and be kind. And at the end of the day, we all can have some hope. So I'm going to leave you with hope. Have a great evening.